Good evening. You are welcome to another day. Let me ask before we continue or we start, how was our day or how is our day going? How is our day going?
Fine, sir.
All right. Thank you so much. You are welcome. Good evening, doctor.
Thank you,
This is Dorothy. Good evening, ma.
Good evening. I'm
sir.
Smart Solutions. Thank you
You are
so
welcome,
much.
ma.
How
How
is
is the
your
evening?
day? Fine,
Fine,
thank
ma.
you. I thank God.
Okay.
Welcome.
You're welcome. Your participants, the students are waiting for you.
We are
Okay.
already seated here. We are waiting, ma.
Thank you.
Good morning.
Good afternoon or good evening. Sorry, it's not even afternoon. Good evening, everyone.
Good evening, ma.
Good
It's
evening,
nice
ma.
to be here again. Thank you for being on time. Thank you for coming and waiting. Today, I realized that we've had, I think, about 9 people wait for me. All these days, I think I used to be about the first or the second to be online. So thank you so very much. I appreciate that. I'm only just wondering why we are just 11. I don't know why the others have not joined us. Today is a very important day.
Let me keep Chca outside. Okay.
That's why, why do I say it's important? It's a day that is set aside. We are just going to look at only one module today. And that module is broad. If you look at the post we've been posting, you'd observe that we said you'd have 2 certificates. And one is going to be your CHCA certificate, that's a Certified Healthcare Assistant certificate. And then you'll have an additional certificate, which is Mental Health Awareness Certificate, MHA from BCC. So today, before we give you that certificate, we have to give you of men should be aware of your mental health, how to handle yourself, as well as how to handle patients that you
I hope it's not network. Oh, God, help me. Okay.
It's network.
Okay.
Mm.
Okay.
it's
Yes, ma'am. Yes,
I'm
ma'am.
trying to see, please. Just give me 5 minutes. Just 5 minutes. Would start in the next 5 minutes, please. I need to swap. And this MTN, you see, immediately it locked me out just in a space of 5 minutes. I don't know why network is doing that. So let me change my provider, please. Just bear with me 5 minutes, please. Are we together? Can I go ahead?
Yes, ma'am.
Ma'am.
Thank you. See how to. Let me see. Network will favor us. I was even the one talking about network. So I hope network did not hear me and suddenly become angry that I was talking about it. So, but I trust that would just network will favor us today. Please, can everybody hear me? We are just about to start without wasting time. Please, are we together?
Yes,
If we are
ma'am.
together, please, can I hear the response?
Yes, ma'am.
Yes, ma'am. We are together.
So let me share the slides and then we move. Now, like I was saying that MHA is very important. That's mental health awareness is very, very important for all health workers to have that qualification. If you need to work in the hospital, you need to work anywhere where you have to be dealing with patients, it is paramount that you have that certification, this particular certification, or you have the mental health awareness knowledge. It was based on the feedbacks that we have received and what our participants, our students that have graduated through BCC have given us, told us firsthand. We've been able to know that it will give you an edge if you actually have the certificate. Hence, we incorporated it into the course outlines as one of the modules so that you can have good knowledge of it before we proceed. So now, I just want to, like I like to say, I just don't want to go straight into what we have. I want to just give you a very short story of 5 minutes that would let you know one or two things. One of the reasons, or the major reason that made me to get interested in mental health awareness, I decided to have a couple of certifications. I really delved deeper into it. Now, so many years ago, I was passing through a lot of personal turmoil. I had a lot of things going on. And faced with this stress, faced with the enormous stress that I encountered during that period, I suffered an anxiety attack as a result of the stress, of the pressure that was on me as at that time. So some of those days, I could just decide not to do any work. And on other days, I would just want to maybe just lie down on bed and, keep crying. That's so many years ago. So because of the persistence in that particular situation occurring, that particular attitude occurring, my friend now asked me if I wanted to speak with my friend that knew better. She asked me one fateful day, she said, Dorothy, would you like to speak with a mental health professional about your stress and anxiety issues? When she said so, I shouted, Jesus, why should you say a thing like that? How could I be having mental issues? I felt a profound sense of shame. I felt ashamed for such a statement to come from my friend, asking me if I needed to see a mental health professional. And I felt immediately, why did I feel that sense of shame? I didn't only feel the sense of shame, I felt the profound weight of stigma on me. I felt ashamed because of stigma. I felt ashamed because I was like, oh, wow, so I'm now going crazy? Does it mean I'm now going mad? How can my friends suggest a thing like this to me? So that weight of stigma, what would people say when I visit a mental health professional? What would the world say? That was the fear I had as at that time. Though I had a supportive family and I had loyal friends, I had very loyal friends, yet I could not speak to any of them about my feeling of pain. Is that bad? I'm driving at something. I could not speak with them. They were loving, they were loyal. I had a supportive family, but I couldn't open my mouth to tell anyone my anxiety issues, my stress issues. I couldn't tell anyone because of the weight of stigma, the weight of stigmatization. Now, I just think that I felt suffocated by the rigid architecture of our own African culture, of the way we reason and the way we think. I think those were part of the things that disturbed me, that affected me then. So while growing up, when I hear about mental, or I hear mental, not even mental health, when I just hear the word mental, what comes to my mind or to the minds of anyone, a layman hearing mental will say, what you have in your mind is a picture of a madman with dirty dreadlock, moving around, perhaps half naked, picking things out of the gutter on the streets. That's what comes to your mind when you hear mental. We all know this man. And when we ask our parents, maybe that time when we see the man and we ask our parents, oh, why is this person moving like this? And sometimes our parents could say maybe he's a wizard, the person is a wizard or a witch, or they could tell you it's drugs, is a result of drugs. That person has taken a lot of drugs. And they will so tell you that even if you as much as look at drugs, you become mad as that person is mad. So they put that fear in us. And so we grew up with the fact that anything mental, we hear mental, run, no, you just have to run because that's talking about madness. That's just it. That's what we used to think. That's what I used to think up until I have this knowledge that I have today. So let's look at it this way. Come down with maybe pneumonia, and your parents would rush you, or your friends would rush you to the nearest hospital for treatment. Or you have even cancer. If someone, God forbid, someone has cancer, they rush you to the hospital. You have malaria, they rush you to the hospital. But dare to declare that you have depression, just dare to declare that you have anxiety issues or you have depression. And what do? Depends on their religion. They will send for your pastor, maybe your local pastor, to come around and pray and cast out the demons, or blaming your village people being after you. That is the mentality that we used to have. Now, a study was actually carried out by Abolida Flores some years ago. And what was the study about? He wanted to find out from people what they actually think is the cause of mental illness. And so he asked a particular percentage, in fact, a good percentage, a good number said mental illness is as a result of karma. Maybe something someone must have done wrong. It comes back to haunt you. So maybe you've hurt someone along the line. Some people attributed it to witchcraft. Some people said maybe the wrath of God, payback time. And only very few people actually said the real reasons, like genetics, maybe social and economic status. Some said war, some said conflict, some said maybe loss of a loved one, someone that they really love, But globally, 75% of mental health issues can be found in low-income countries, in countries where they are still third world countries, low-income countries. That's where we really have issues. 75% of mental illness or mental health issues come from these countries. Yet Africa, this Africa that we belong to, African countries invest less than 1%, just number one, less than 1% of healthcare budgets in mental health. You can see how bad that looks. I don't know if we are together, if we are listening, because it's very important that we all listen.
Yes, ma, we are listening.
And let it, thank you, and let it appeal to you. I mean, it's this mental health awareness training is for you to, it's really an emotional one. Anytime I have to do this, it's really an emotional one because when I talk about it, I remember how it was with me, and I begin to put myself in the shoes of 1,001 people that have this mental issue. So as healthcare workers, it is important that we learn this and we learn it well. Let it touch the very depths of us so that we'll know how to handle these patients or handle people that are in our care when they actually have mental health issues. So as I was saying, in Nigeria or in Africa, let me not say in Africa, just 1% of the budget for healthcare is attached to or is kept for mental illnesses. You can imagine that. That's a sad situation. Nigeria, our whole Nigeria, for instance, is estimated to have 200 psychiatrists. 200, just 200 in the whole of Nigeria. In a country of over 200 million, just 200. What does that tell you? It tells you a lot. Okay. Now, in all of Africa, 90% of people lack access to treatment. 90% of people that have mental health issues, maybe they have bipolar disorder, maybe they have schizophrenia, they have dementia, they have the list is Alzheimer's disease. They have a lot of mental illnesses, but we don't have the professionals that can actually handle these things. And truth be told, money when we look at the financial aspect of it, not everybody can afford this treatment when you actually need it. That is why we need to be aware of how to deal with our mental health, how to take care of ourselves. Anything that would tamper with your mental health, please just do away with it. Just do away with it. Like Christians, the Bible says that anything that will make you to sin, if your right hand will make you to sin, cut it off. So I'm relating it to this. If anything will affect your mental health, will make you degenerate up to the extent that you you have mental illnesses as a result of maybe pressure or anything, please cut it off. Just do away with it, because mental health is very important. So as I was saying, many people suffer in all of this Africa that we are. 90% suffer in solitude because they don't have access to treatment. They don't have the financial capability to even be treated when they have any of these issues. They have depression, they have anxiety, they have bipolar disorder, and the list is endless. They don't have the means. Now, we often respond. What do they do when they don't have the means? They just end up suffering in solitude. They just suffer, silenced by stigma. Most of them may even have the means, but wow, because your neighbor will say, really, this person is actually mad. So great, so heavy is the fear of being tagged a madman or a mad person. That's why so many people die in silence. Some people even go to the extent of committing suicide because they just want to end it all. They just don't want 2 or 3 people to know what they are going through. They see it as a taboo. They see it as an attack on their virility, an attack on their person, which is not good. So this awareness is one of the things that should help us. Like, we are having this training, we should reach out to people. You have loved ones, you have friends, just lend a hand, just reach out to someone you've not talked to for a long time, because people are actually going through a lot. And so that with this training, you will not say, oh, if I had known, perhaps I would have acted like this before it is too late. So it is important. Now, we often respond as Africans, like I said, we often respond to mental health with distance. By the time you start experiencing that, you feel that you start experiencing any of these things, you feel the world has come to an end, you distance yourself, ignorance, guilt, fear, anger, a whole lot of emotions come to play when people have mental illnesses. So the stigmatization against mental illness always results in dehumanizing or dehumanization of the sufferers. Most times you see these people that actually have these challenges, especially the young ones that are less privileged. Maybe they are not well to do, they're not in that class. They are treated, they are dehumanized. In some countries, in some religions, you see, they find out, they tie these people, they flog them, they do a whole lot of things, because they attach spirituality to it. But in the real sense of it, it's something that needs therapy. It's not everything in life that has the spiritual connotation attached to it. Yes, it's not. So what is medical? Fight it medically and also face it spiritually as well. Do the two at the two sides so that you know that, yes, at the end of the day, you will achieve it. So this is very important. Now, they dehumanize this, they flog them, there are some that will even take them to church and they'll tie chains on them, drag them. Human beings. You can imagine how sad that looks. Human beings. Why? Because they lack the right knowledge. They don't have the right knowledge. This is very important. So now, for me, this stigma is personal. That's why I started by telling you the story. For me, the stigma is personal. I received a call some years ago. I received a call. So many things led me into this aspect of mental health. I received a call so many years ago at I think about 2 a.m. in the morning. I was fast asleep when I got a call. One of my friends, a very good friend of mine, loyal friend, we've come a long way from primary school. I received a call that she was diagnosed with bipolar disease, that she had bipolar disease, which is an example of mental illness. Now, I witnessed certain things. I witnessed as our friends, our circle of friends, a circle of friends that we were very close before attached. As soon as it was common knowledge that Mary had bipolar disorder, the friends we had started to retreat. They started to stay away. I heard it all. I heard the whispers. I heard the sneakers. I heard the derogatory statements. I heard the demeaning comments that were used. when relating to her. And people were like gathering in spaces, talking about her, and about her condition. I listened, I heard words that they would not use about someone that has malaria. They will not even use it for someone that has cancer. They will not even use those words. But when it comes to, anytime it comes to mental illness, there is how our ignorance of what to do, or general ignorance, just eviscerates all empathy from us. And we don't even show that sympathetic part. If someone has an accident now, someone has malaria, oh, please go to the hospital. Don't worry, I'll take you to the hospital. The doctor will attend to you. They will treat that person with empathy. But when it comes to mental illness, everyone goes away. Everyone goes far away. Why? Stigma. Because even the very people that align with this person that actually has a mental illness is also termed as a mad person, in quotes. So people try to shy away, and even the very people that should give that shoulder to lean on, that should have the right knowledge, they don't. So I'm almost rounding up. We are coming. I just want to give you an introductory part of it. So deep, right? Like I said, is our fear of being the madman. We Africans need to realize something. Even those that are not Africans on this platform, we need to realize that our mental struggles, that everybody has, we all have mental struggles. So our mental struggles do not in any way detract from our virility. Nor does our trauma, the trauma that we pass through, the wears and tears of life, the stones that we receive, and the stress, the anxiety, and everything we pass through, does not taint our strength. It does not in any way reduce our strength. It doesn't tamper with our strength. We still remain humans, and we still remain who God has destined for us to be. Nothing can stop it. So we should see mental health as important as physical health, because that's the A to Z of what we are saying. If people actually know that everything starts from the mentality, the A to Z of a human being, we talked about anatomy and physiology the other time, the A to Z of a human being is from the brain. The brain censors everything you do. So your mentality, anything that's going to do that will affect your mental health, please let us ensure that we guard against it. When we begin to understand mental health and take it as seriously as physical health, please, let's mute our mics, please. Let's do what we have. Infinix Hot 6, please, can you help us? I don't know who is using that Infinix Hot 6, please. Today we have a lot to do. It's just one module, but we have a lot of slides and we have to do justice to it. So let's mute our mics, please. So as I was saying, we must stop. We must stop. We must attend to our mental health just as we have a cut. If you have a cut, now you know what you will do. You will not... You rush and do what you have to do. So if you have any mental health issue or you have any mental illness, it's not about the one someone would have to move naked and do all those things. No, that's not the one we are talking about, because that is the mindset of people. There are a lot of other illnesses that is constituted under mental illness that doesn't degenerate to that, or it's not that. You understand? So we must stop stigmatizing people. We must also stop suffering in silence. When you sense that anyone has any issue, every damn day we get to hear people fall into the breach. We get to hear this commit suicide, and we don't even have the right statistics of suicide, because many suicides attempts or suicides, are not reported because of stigma. But we'll get there. Let's take it one at a time. So we must stop stigmatizing diseases. And we should stop traumatizing the afflicted, the people that actually have these diseases. It's very human to be vulnerable. When you have challenges, be vulnerable. Let's just reach out to someone that you can talk to. Just try. If you have people like health workers, now you may have people, 1 or 2 persons or people that may have these mental health issues. Just reach out to them. Show them love. Since you have the knowledge, you are different from others. Every October is mental health month. So when it gets close to that time, it's beautiful. This training is even coming now, and it's coming handy. We have trainings. We offer a whole lot of trainings to make people be aware of mental health, because the more we do it, the more people begin to know that they are not alone when they are passing through some. They're not alone when depression sets in. It's not a taboo. Let people know that it's okay to be vulnerable in certain situations, that it doesn't reduce you in any way. It doesn't make you less of a human being if you are vulnerable. So these are things that we need to really, really understand as we go ahead. Be vulnerable. Don't be afraid to be. Do something. Just do so. Be vulnerable. Do so with confidence that you are not alone. That is the beauty of it all. Like my mother always used to say, that is the roof that covers a whole lot of things. You know, the roof covers what I do in my house. Your own roof covers what you do in your house. So the roof covers a whole lot of things. If only the tops of people's houses were open, then you get to see a whole lot of things that happen with other people. And you will not give yourself a death sentence because you are passing through one thing or the other that will make you depressed or to have anxiety issues. So that being said, we are going to now just delve into what we have. I just wanted to give you an introductory aspect before we move to what we have. Are we together, please? Pardon me. Sometimes
Yes,
I
ma'am.
get emotional when I talk about mental health.
ma'am.
So let's
Yes,
move.
ma'am.
All right. Someone is saying no volume. Jovita, are you okay? Can you hear me?
Can hear you, ma'am.
Okay, because I've seen no volume, Jovita. So it's okay, you can hear me. Thank you. I keep going through the chat box. So please do yourself justice by putting down any comments while I proceed. Now let's move. Now today, like we have this training, we want to be looking at this mental health awareness. Let me make it slideshow so that we can all see. The slides are a little bit small. Good. All right. So now this mental health awareness, the modules, we have 4 modules put together for this training that you can see there: introduction to mental health and mental illness, depression, anxiety disorder, and so on and so forth. Good. So this is the 4 modules that make up this particular training. Take note, like I said earlier, that this training is more or less standing on its own because you are going to be given a certification. Normally, mental health awareness trainings is done a day. It's just one day training. So it was incorporated into the modules to ensure that you have the certificate in case you may need to work out as a healthcare, as a worker, not only working out, even in Nigeria. It is going to be a plus to you because only very few healthcare practitioners actually are certified in mental health, as in are aware of that. So it makes you to it makes you a hot cake. Let me say so. So at this point, we have the 4 modules. So let's write on. The first is mental health. Now, what do we mean by this mental health? What is mental health? Anything, according to WHO, according to World Health Organization. Okay, just give me a minute. I was trying to. Okay. Now, according to WHO, World Health Organization, mental health is simply a state of well-being, like we have seen here, where you as a person, you can realize your abilities. You have the ability to cope with the normal stresses of life and work. That's just mental health. Where you have there, nothing disrupts you. You can cope with pressure. You can cope with, that is just mental health. It also refers to the emotional, social, and psychological well-being of a person. Yes, your well-being. Mental health in totality talks about your well-being. How are you doing? Are you good enough to handle your responsibility? Are you good enough to do the work that lies ahead of you? That is mental health. Awareness is very, very important. That's the meaning of mental health. You're emotional. Are you able to handle the emotional aspects of your life efficiently? The social aspect, you go out, interact with people. Are you able to handle it? The psychological aspects too. Everything to put together is what is considered mental health according to WHO. Good. So let's write on. Now, tips for improving your mental well-being. There are many things you can do as a healthcare worker, as a worker in the health sector, or as even if you don't work in the health sector. It's very, very important that you do certain things to help keep yourself in one piece. Let me say so. Keep yourself in shape. Organize your life. There are many things you can do. Tips for improving mental health, mental well-being, which is mental health. Try to relax and reduce stress. This is one thing I tell people when we get to stress in one of the modules. I tell people that when you would work, take note of your terms. Listen to yourself, hear yourself as well as you can hear your, not hear your child, in quotes, for herself, and know where whatever is going wrong. So try to relate.
Network. Chca.
Hello.
Hi.
It is well with us. It is well with us today. Sorry for that break. I have changed my provider and it's still giving me hell. So sorry for that break. Let's continue. Sorry.
Network.
Network today, the weather over here is not very friendly, so it's just I don't know. But however, let's get back to what we're doing. I pray God favors us today because we have a lot to do. Please, are we together?
Yes, ma'am.
Okay.
We can
I think
hear
only
you, ma, but it's breaking.
It's breaking. Yes, it's breaking.
okay.
It's
Let me try
breaking.
again. I just pray God will help me. All right. We're talking about the tips for improving your mental well-being. Try to relax and reduce stress. Please, are we together? Is it better now?
It's better. It's better,
Yes,
ma'am.
ma.
Okay, so
Yes, ma'am.
find ways to learn and be creative. Find ways to learn and be creative. Relax. When you are stressed, try to do the things that make you happy. Relieve yourself of stress. The Infinix Hot 6, I'm still saying, please help us so we can move. Now, spend time in nature. There are people that find joy when they go out, sit down like the whites. I've had a couple of them, friends, that they feel better. Some of them just go to a stream or to a river and they just sit down and stare. They watch the waves. Just watch nature. Just watch nature, if you are the type. It depends on what appeals to you, because what appeals to them may not be what appeals to us on this other side. So depending on what appeals to you, take time to do it so that you can improve your mental well-being. Sometimes when there are issues, when you are passing through a whole lot, do the things, like I said, it's only you that can listen to yourself. So there are things you know that when you do, that keeps those things. Connect with others. Connect with others. It's very important that everyone, you try to have your social life, regardless of how bad the world is. Try to have your social belong, that, you can go out, sit down while you wait time, laugh out stress, just laugh. Try to be happy. That's just it. In as much as the economy is tough, we understand that one of the major issues also that causes mental illness is how tough things are. So that one alone is for another day. It's a different topic on its own. So, but back to what we're saying, connect with friends, look after your physical health, try to improve your sleep. Try to improve your sleep. This is important. Try to sleep, because sleep has a form of rejuvenating therapy. It helps you get better if you sleep. It helps you feel relaxed. You take your rest and then wake up. These are things a whole lot too. So let's look at what we have on the next slide, please. Let's walk. Just stay with us. Okay, now, importance of mental health awareness. Someone may say, why am I even having this mental health awareness? It's not this, it's not that. Now, this is the importance. This said to those that work in health just as you are, by the grace of God, going to work in the health setting. If you are not already working there in the health, employers look out for this particular certification, because this is the importance. Now, it helps you can handle patients in insane asylum. No, even when you're that, these people avoid. I'm not happy with this. I'm not happy with what network is doing to me today. Sorry, please. We had a break in transmission. So when it happens like that, just bear with me. It's not really my doing. I've changed all the networks. I've done everything. So I just hope that, well, let's just move. Please just hold on. Let's see if. Sorry, I was trying to see how this one would look like. I'm trying to change it.
Yes, ma'am.
Thank you. Thank you. That beautiful voice that I always hear. Thank you. Okay, so let's just move. Let's get to what we were saying. Importance of mental health awareness. Like I was saying, it's very important for healthcare practitioners to a knowledge, vivid knowledge of mental health and mental illnesses, so that they'll be able to handle the patients that they have. Does it help us? Let's see. Let me take it to slideshow again. So we'll just move. Okay, God should help us, please. Now, why we want to look at the importance? The first is improve patient's care. Now, when you have the knowledge of mental health awareness, it allows you as a healthcare worker to provide comprehensive care that addresses both physical and psychological needs of the patients. That is one importance. And it also enables you to communicate effectively with patients about their mental health fostering trust and openness. You know, one very important thing is the connection you have with your patients. So if you have this mental health awareness, of course, stigmatization wouldn't come in, no matter what they are going through, no matter the condition, the illness they have, be it just a physical illness or a mental health issue. It will be easier for you to connect with them and understand how best you can help them because you already have the knowledge. That's the edge we are talking about. So that's the first. Then we also have early identification of issues. Early identification of issues. It would help you to recognize signs, and you'll be better equipped to identify signs of mental health issues in patients early. You wouldn't wait until it degenerates. You see, like this knowledge you are having, like I keep saying, that this training encompasses a whole lot. You get to use it outside your immediate setting of healthcare. You can use it even with your relations, with your friends, with your family, with your spouse, you know, because you would firsthand begin to sense when you see this maybe suicidal ideations or you see depression signs and symptoms, you will read it faster and better and earlier than someone that does not have the knowledge. So you see why it is important. Another thing is early recognition. When you are able to recognize it early, it prevents the deterioration of mental health conditions, leading to better outcomes for patients. Just as we have said, when you saw, it's just like any other illness. Early detection can help nip it in the bud, can help that person to get better. So that is why it is important that as healthcare practitioners, you have a vivid knowledge of mental health and mental illnesses so that you can help identify such when you see them early and on time. Also, another very important importance, I'm taking time to explain so that you understand why you need to have this training and you'll be able to defend that particular certificate that you would have at the end, that extra certificate that is added to you, that advanced extra certificate that is added to give you an edge. Now, another thing is reducing stigma. Increased awareness helps reduce stigma around mental health issues. Now, the more people become aware that mental illness is not a death sentence, that mental illness is not must not end in suicide or suicidal attempts. No, as the more people get aware of mental health, the better it is. Most of these issues we have every day in the news of people committing suicide, of people being withdrawn, and a whole lot would be at least we'll have it reduced to the barest minimum. That is why it is good. And you know, stigmatization being one very serious or major issue that have made many people die in silence. Stigmatization, because of the fear of being stigmatized, because of the fear of being of having a mark that will go with you all through. People will talk about you. You will hear whispers, you hear sneakers, you hear people use derogatory comments, attaching it to you if you've had an episode of that, or you've had maybe mental illness. So people are so scared. Now, at this point, this training, I am going to be pausing intermittently to give you certain illustrations. Like I said, this is the only module we have for today, and it's broad. So please just sit relaxed and enjoy all through and contribute, because we'll get to a point where I'll throw the floor open, and it will be very sad if no one contributes, because this is something that has really eaten deep into the fabrics of the society. So we have to deal with it in our own little way. So now, some time ago, I like to give illustrations. Some time ago, somewhere where I work, there is this mother, so many years ago, when I was teaching, actually, I had a child that entered, that was in my class, a new pupil that just joined, that was just admitted. And I observed that the child was actually exhibiting certain behaviors, certain, attributes like that. As at that time, I wasn't really into this mental health thing. So, and that's why knowledge is important and knowledge is good. As at that time, I didn't have the knowledge, but I observed something that I later understood what it meant when I had this knowledge. The mother actually knew that the child had some challenges, but she did not want to say it. The child actually had issues, like throws things, tantrums, throws things, destroys things at home, and had this temper issues, had a lot of things going on. Actually, the child had bipolar disorder, a boy of about 13 years old. 12 years old as at that time, you know, had these issues. And the mother, actually, the parents knew, but you know how it is when you fill the form, you have to disclose the health status of your child, and you have to just state how the child is. If there's any challenge, you let the school know. She didn't put it in the form. She just brought the child to the school, and the school is not a special school. It's a school for, it's a normal school. So, but when that particular situation increased, the child has mood swings, it's like this. The next minute he's throwing a book. The next time he's doing this. It gave us cause for concern. And as the school authority got aware of this, they had to send for the parents. They tried to find out if this child has any underlying illness, if there's anything that the child has some attributes of mental illness. But just that word alone, the mother was like, no, that the child doesn't do that at home. In fact, the child is okay. Maybe there's something actually that affects the child when the child gets to the class. You know how some of us parents, we can be very defensive when it comes to your children. You know, so she was like that, very defensive. And it continued until the school actually said, since she doesn't want to come out clearly and state what is wrong, since instead of the child creating harm to other children, then we decided to let the child go. And they told the parents to take the child to a special school. It was much later I gathered that child had bipolar disorder, and people that visit the house actually confirmed it. Some people don't even like visiting the house because of the challenge, because of what the child exhibits. And when there are visitors or people are around, they don't allow the child to come down to the sitting room. It's as bad as that. So when I got this knowledge of this, I now began to put two and two together. And I saw the weight of stigmatization. I still repeat this, what stigma can do. It can, most people that die, they don't die because they want to die. They die because of the depression, or because of everything that comes with the stigmatization, the society, the workplace, the church, the environment, everywhere. People that don't have the right knowledge stigmatize them. And so they just feel, let me just end it all once and for all. And you know, which is not good. So as healthcare practitioners, we should try to see how to guard against stigmatizing our patients or stigmatizing people that actually have these issues. That is very important. Now we get to the next one, enhancing team collaboration. Mental health awareness promotes collaboration, you understand, among various healthcare professionals. Like you are a member of the healthcare team, you are a healthcare professional. You know, when you work with others, it leads to integrated plans that consider both physical and mental health. So when you as a professional now, a mental health professional, you are aware of mental health and the challenges, you work with others hand in hand to create the care plan for the patients. It will be easier because you will be able to handle not only the physical aspect of it, but also the mental health issues or anything regarding mental health that will pose that would have ordinarily posed as a challenge to you when you are in the workplace or working. Good. So a common awareness of this can improve your teamwork, your communication within the health setting. So those are the importance. Now, supporting healthcare workers' well-being. Understanding mental health can help healthcare workers, as you are one of them, or you have examples of them, you know, recognize their own stress and emotional challenges, encouraging them to seek support when needed. So this is very important. Yesterday, we talked about caregivers burnout. We talked about burnouts, that as a caregiver, as a healthcare worker, you are prone to get to a point where you have that burnout. No matter how perfect you are, even if you are 100% in your work, like you are good at what you do, they will certainly get to a point in your career that you would have that burnout. It's normal, it's natural. So when it gets to that point, it is important that you already have the knowledge of what to do when you get to that bridge. You know how to cross it. You understand? So it helps you, when you have this knowledge, it helps you recognize your own stress, because you get stressed. You have the emotional burnout, you have emotional challenges. Take, for instance, you are taking care of someone, you have built that connection, you've built that love, you've become more or less a family member, because when you keep taking care of someone, you see the person metamorphose from stage 1, maybe stage 2, and then the condition continues to deteriorate. You have created that bond. So if anything happens, which we cannot guard against, maybe in the long run, you lose the person that you have been taking care of course, that alone can hammer down on your mental health, can hammer down on it, when you keep thinking of someone that you firsthand give care to and something happens, and a whole lot, you may come in contact with people that actually have the challenges, they actually have challenges. They are challenging, difficult. They can give you different types of, they can test who you really are in your job. So when you get to those stages, you can get angry, get to a point. So with the knowledge of all this, you'll be able to handle them better, realizing and understanding that it is the illness that has created their vulnerability, and you are able to differentiate between their vulnerability and them as individuals, and first and foremost, human beings that were created by God. That is important. So you see that you gain a whole lot taking this training as a healthcare practitioner. Good. It can also help you, cope. You have coping strategies like I talked about, and self-care practices, reducing the risk of burnout, like I already said. You do a lot of exercises, take fresh air when you have gotten to that point of no return, like you've had it up to here. You are just feeling so bad about maybe something that happens. You just pick out one of those things that you have learned and practice the strategy and just carry it out. Go out, take fresh air, breathe in, breathe out. Remember something that makes you happy. Clench your hand into fist in your pocket and just move out, like on a fine day, a husband would do. Some husbands, when they get very pissed off at home, maybe the wife does something and they are really angry, in order not to lose guard or do something that is not good, they will just maybe wear their shirt, pick up their keys and go out. That's a way of going to loosen that. And when they come back, they will be happy and life goes on. So that's just it. It's very important that we have this training. Then improving outcomes too. We talked about that. Patient's care, to help in patient's care for outcome, quality of care that you give to the patient. Patients with mental health issues often have co-occurring physical health problems. Awareness helps them to address you being aware of this helps you to address all these things holistically, improving their overall health outcomes. Good. Now, we also have the last but not the least, the legal and ethical responsibility. Now, understanding mental health issues can help you comply with legal and ethical standards in providing care. Awareness ensures that you, as a healthcare worker, are informed when discussing treatment options that may involve mental health considerations. So you also look at the legal aspect. In anything we do, we compare, we look at the legal aspect of of things. So this primarily, that being said, we have talked about mental health. We've talked about tips to keep in one piece to help us to maintain our mental health. And then we've talked about, very importantly, the importance of mental health awareness to us on this platform now, as we are taking this training that will extend to our patients and will affect the level of care that will actually give to our patients in the course of us carrying out our duties. So that being said, I don't know, do we have any contribution or any question to ask before we go ahead? Thank God. Network. I'm happy network is favoring us. Please, are we together? Can everyone hear me?
Yes, ma.
Yes, ma'am.
Okay. Please, at any point you don't hear me, I plead, let me know, because
Yes, ma'am. We can hear
Yes,
you.
ma'am.
all right. So because I can be talking and talking, that's happened to me before on a training, and that's why I'm conscious of it. I was talking and talking the way I like to talk, because I like to talk a lot. Those that know me, I talk and talk. So I was talking, not knowing that I had talked for over 15 minutes and no one could hear me. So since that day, I make it a point of duty to pause ask if you hear me. Okay, so we want to look at mental disorder. When we get to the question part or contributions, I'll pause and then we'll get there. I just want to move as fast as I can so that network will not hold us. We'll finish in good time and conclude what we have. So mental illness, like you can see here. We finished talking about mental health. We've talked about how to cope, mental health, and so on is few. Now we are delving into mental illness. Remember, we're talking about mental health and mental illness. Now, mental health, we're done with that. Mental illness is a disorder. It's a mental disorder that has got to do with the brain. Mental is a mental disorder. So when you hear someone, they say someone has mental illness, means that one or two things. The person's brain has been affected. Chemicals, maybe chemical imbalances in the brain. There is certainly a problem. So a mental disorder is not a death sentence, like I said, is a diagnosable illness. Mental illness is a diagnosable illness. Let nobody deceive anyone. If you have the right knowledge, it's an illness that can be diagnosed, you understand, and can be treated like any other illness. So even when someone has any of them, depression, whatever, we should understand and be careful. We should understand that it's as good as any other illness, as in not good, sorry to use that word, good, is just like any other illness, because no illness is actually good. So it causes major changes in a person's thinking, emotional state, and behavior, can disrupt a person's ability to work, to carry out your normal ADLS, let me say, activities of daily living and others as well. So that is mental illness. So when you hear mental illness, you know what we are talking about. There are different types of mental illness, a whole lot, but within this circle, what we can see here, you can see the types that we have. You can see eating disorders. You can see schizophrenia. You can see anxiety disorders. You can see depression disorders. You can see bipolar mood disorders, personality disorders, as well as many others. The list is even dementia is a kind of mental illness, and so on and so forth. So these are practically it. So people are so scared of mental illness. Like I was telling you about that lady, you can imagine how a mother will not even want to help her child, because if she had divulged, told the school what the challenge was, would have looked at ways to help that child. But she didn't say it. Why? Because of stigma, because of her class, because of a whole lot of things, looking at the society. Wow, they'll say this woman has a child that is this and that and that. So it's very severe. So all these things put together are examples of mental illness. Now, depression is the most common cause of suicide. Statistics has it that one of the major causes of suicide is depression. When you get to a point whereby it's like the world has no more meaning. It's like you are moving backward instead of moving forward. It's like nothing is just working out for you. And at this particular point in our country today, with the hardship and everything, people are prone to delving deeper into depression. That is why we should guard against these things, and we should help those that we can help. Do in your little corner. I do in my little corner. Gifts does has in a little corner. Aminat does has, and so on and so forth. If everybody on this platform, like we have 25 people that have actually registered for this training, if everybody in their own little corner can create awareness on mental health, can check on one or two people they know, can reach out to help anyone they see that is depressed, I tell you that we would have most of our problems reduced in the world. So thank God for the training. Let's move to the next. It's important for us to understand depression so we can address the suicide risk. Now, there are two different things. We have depression and we have anxiety. These two causes are, these two mental illnesses are very, very, depression and anxiety disorders. They are majorly the cause of suicide, of things that happen, of people drifting into killing themselves. Before you know, something will be disturbing them. They are being affected, but they cannot talk. Oh no, they cannot talk. A child will not tell. The mother will just prefer to die, be in silence, just prefer to be in solitude and be in silence. That's why if you have grown-up children, it's not our portion anyway. It's not our portion, but we must know that. We must know what we need to know. You have children, you have somebody that is withdrawn, you know the person, but all of a sudden you see the person withdrawn, you see the person staying in one place, you see the person not interacting, avoiding any social activity, keeping to himself. Please, in most cases, begin to read the handwriting on the wall. Begin to read the handwriting on the wall, but we'll get there. So, high prevalence disorders, these two are high prevalent. It's prevalent. It keeps reoccurring in population than other mental illnesses. These two are very common. That's what this slide is actually saying. Now, according to statistics, about 18% of population met this criteria. Almost 10% suffered from anxiety disorders. When statistics was carried out, you see that people with mental illnesses, when they were grouped, you see that some depression, you see the rate, some anxiety disorders, and then substantial numbers suffered from more than one. We'll get to that particular state. there are situations where someone suffers from more than one particular mental illness. You can see someone having anxiety disorders. You can see someone having maybe schizophrenia, and the person is having bipolar disorder, having more than one disorder. So in such situations, you can imagine if one can send some people to suicide. Imagine if a person is having more than one disorder. It's not what you even wish your worst enemy. So it's important we have this knowledge. Now, we have different terms. We have what we call comorbidity or dual diagnosis. It's the one and the same thing. Either you say dual diagnosis or you say comorbidity. They mean one and the same thing. Now, it's used to describe that situation that I just talked about. Occurrence of more than one illness or disorder in one individual, one single person. So you see, people go through a whole lot, having this and also having that. So people with comorbid conditions are more vulnerable to alcohol, to drugs, issues, and relapse of mental health problems. People that have comorbid situations where they have more than one particular mental illness, you can imagine what they would feel or what would happen. So, Dami, please help us. Dami, please mute your mic and move. So we actually talked about comorbidity, and we said that it's associated with greater impairment, higher risk of suicidal behavior. People that are comorbid, people that have this particular issues, have more than one, are prone to committing suicide, to have suicidal ideations, to have suicidal tendencies. This is very, very important. Now, prevalence of mental disorders. We've already said that it is prevalent. It's the third biggest health problem in the world after heart disease and cancer. That's what statistics tells us. The third, 1, 2, 3, the third biggest health problem in the world. Mental health problems. That's all we've mentioned: bipolar, schizophrenia, dementia, Alzheimer's disease, and so on and so forth. All of them. So now mental health problems are the largest cause of premature deaths in Africa, and not only in Africa, in the world at large. 1 in 5 has had a mental disorder sometime in the past 12 months. So you see, the statistics is real. Statistics is real for us. So, all right. Are we together, please?
Yes.
Can you hear me? Right on. Okay.
Yes, ma'am.
Yes. Yes, ma'am.
If you have any question or you have anything, please, I like to see your questions in the chat box. I'm supposed to be 25. As I like to do, I like to look at people that are on the platform. Thank you. And see Jovita, Kate, Nora. Okay. Nora, it's nice to have you. I can see Madam Ugweze. I trust you are better. Madam Ugweze, I trust you are better today. Are you?
I'm fine. I'm good.
All right. Okay, so Promise, Uchenna, Sarah. Wow, I need to, Madam Sarah, it's nice to have you. Hello, Madam Sarah. Okay, Madam Sarah is reaching us from Ghana, so I don't think I saw her yesterday, hence I decided to. So let's just continue. Let's ride on. Now, stigma of mental illness. Mental illness can stop people from admitting to I beg your pardon. Stigma can stop people from admitting to a mental illness, believing that it is a weakness in their personality. You remember when I started, the stigma, so this person has depression. Oh, they see it as a weakness. They see it as making them feel less of a human being. Oh, how can I just tell someone I have depression? Oh, I have anxiety disorder. I cannot say it. It's so embarrassing. It's so shameful. They will laugh at me. They would, they would talk about me and so on and so forth. We've gone past that era. It's better someone talks about you and you get better than someone talking about you and you end up where you shouldn't end up. So which is better? Now, it's one of the biggest hurdles that people with mental illness have to overcome. Sometimes it can be seen as something to be ashamed of. These are the reasons stigma. These are the effect of the weight of stigma on people. It can stop people from accessing appropriate help, because if they say a problem shared is half solved. So ordinarily, minus any challenge you have, you share with another person, a good person, is half solved. That is what English, that is a popular saying. So when someone has this challenge, it is better you overcome stigma and you share, not only as healthcare practitioners, because we are also humans, but so that we can also help people sense the signs and help our patients when they are aware. When you make them aware, when you sensitize people, they will be better equipped as to handle these issues when they come face to face with them. Okay, stigma can have a severe impact too. It can reduce access to opportunities. This is a continuation. It can have a severe impact. You see how heavy the weight of stigma is very heavy. It causes a whole lot of things. It's just like if you cast your minds back to when HIV came, when we had the AIDS, the HIV, you and I, medical practitioners on this platform, and even those that are not, you and I will agree with me that so many people that have lost their lives long time ago, you say this person has HIV or this person has AIDS, not HIV, but AIDS. They lost their lives because they refused to seek help because of the weight of stigmatization. They refused to even go and check their status to actually know if they have it. Why? Because, the world will say, if the world knows I have HIV, hey, my God, it's finished. My employer will send me off work. My this will do this. That initial time. But now, thank God for the awareness. People even get to know that you can live with HIV for many years. In fact, you can even die. Someone can even die faster from malaria or any other thing. When you keep taking your antiretroviral drugs, you keep taking all those things, you adhere strictly to medication, you have a longer chance to live. But that initial time, it was like a death sentence. And once someone knows he or she has HIV, in fact, before the sickness even killed you, you have killed yourself because of the stigma, because of people laughing at you. So you see, stigma cuts across not only mental health, but a whole lot of fear, and fear too. The fear kills you. It's the fear, the stigma, and then the fear of you. Oh, I have this. Oh, you don't even want. So it's a whole lot. So it can lead to self-esteem. It can increase isolation and feelings of hopelessness. Discrimination and abuse can occur even up until now. When I go about maybe doing my rounds, visiting hospitals, trying to do one or two things that I know how to do best, I have seen it firsthand. What goes on, discrimination, even up until now, with the level of awareness, it is difficult, especially in these parts. These are our own parts. It's difficult to just eradicate it. Hence, the importance to make people aware, the importance of the sensitization, the importance of creating awareness for people to know, because the more people have the right knowledge, the less of the weight of this stigma on people. And perhaps we'll have less occurrences of people ending it and ending their lives. So there are a whole lot of myths about mental illnesses. What can they be? Some people, there are a whole lot of misconceptions concerning mental illnesses. Some people think that, it affects a few people, only a few people. Some people could say that mentally ill people are generally violent. That's wrong. There are people that depression is a mental illness, and some people depressed. In fact, when we carry out statistics, more people that are depressed are not violent. I've seen a very good number of people that actually have depression, not depressed, but they're passing through depression. As we progress, you see the difference between someone being depressed and depression. They are two different things. All right. Sorry for that break. I had to drink water, I don't only preach, I have to do what I preach. So I need to drink water and stay hydrated as I'm talking. So hence the break. Generally violent. Some people think so. No. Most of the people you see that end their lives and all these things, maybe they've been going through one mental illness or the other, they're not violent. So you won't even get to know that they actually have that. So these are some misconceptions. Mentally ill people should be kept in a hospital or a facility, or an insane asylum. They are insane, so they should be kept in an insane asylum, or they should be kept in, a psychiatric hospital. and a whole lot. We hear all those things. People with a mental illness never get better. Some people feel that when once someone is mentally ill, that they can never get better or they can never work. So there are a whole lot of misconceptions that are not actually true and not real. Hence, this knowledge is very important. So now we are done with the first module. I want us to see how we can take the second module before we take our break, because I want us to, like loosen up and get better. So we want to look on module, depression now. We've been talking about this disease. Now, depression on its own, like you can see there, over 28, according to WHO, World Health Organization, over 28 million people in Africa suffer from depression, making it the most common mental health disorder on the continent. So you see that it's a very serious thing. It's a very serious thing that we just have to take care of ourselves so that we can have a decline in the statistics and this population of people having depression. So at this point, I would want us to just quickly, before we move, I want us to just watch this video. I like to vary my trainings when I don't just like the type and type and type, the read and read and read. It's boring somehow. So I like to spice it up because, of course, variety is the spice of life. So I like to spice it up. So now you are just going to see the A to Z of depression in this video. Just take time, very short one, and let's go as we progress. Are we together?
Yes, we are.
Yes, ma.
All right, okay. Thank you. Please don't get
Yes.
tired of responding, because I need to know that I'm not talking to myself, because most especially today is mental health and mental illness. So if I keep talking to myself, talking and talking and talking to myself, it means that I will also perhaps be struggling with another form of mental illness. When you just see somebody talking to himself, it's another form of mental illness. So I don't want.
We're listening, man.
Yeah, hearing
Thank
you,
you.
ma.
Right. So let's watch the video. I'm just going to find out if you can hear me, and as I used to do. So let's sit and
Depression is the leading cause of disability in the world.
okay. Can you hear?
Yes, ma.
Yes.
Is it audible, please?
Yes, ma'am.
Yeah, it is, ma.
I can hear you.
Okay, let's go.
In the United States, close to 10% of adults struggle with depression. But because it's a mental illness, it can be a lot harder to understand than, say, high cholesterol. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even a rainy day can bring on feelings of sadness. Sometimes there's no trigger at all. It just pops up out of the blue. Then circumstances change, and those sad feelings disappear. Clinical depression is different. It's a medical disorder, and it won't go away just because you want it to. It lingers for at least 2 consecutive weeks and significantly interferes with one's ability to work, play, or love. Depression can have a lot of different symptoms: a low mood, loss of interest in things you normally enjoy, changes in appetite, feeling worthless or excessively guilty, sleeping either too much or too little, poor concentration, restlessness or slowness, loss of energy, or recurrent thoughts of suicide. If you have at least 5 of those symptoms, according to psychiatric guidelines, you qualify for a diagnosis of depression. And it's not just behavioral symptoms. Depression has physical manifestations inside the brain. First of all, there are changes that could be seen with the naked eye and X-ray vision. These include smaller frontal lobes and hippocampal volumes. On a more micro scale, depression is associated with a few things: the abnormal transmission or depletion of certain neurotransmitters, especially serotonin, norepinephrine, and dopamine, blunted circadian rhythms, or specific changes in the REM and slow wave parts of your sleep cycle, and hormone abnormalities, such as high cortisol and deregulation of thyroid hormones. But neuroscientists still don't have a complete picture of what causes depression. It seems to have to do with a complex interaction between genes and environment, but we don't have a diagnostic tool that can accurately predict where or when it will show up. And because depression symptoms are intangible, it's hard to know who might look fine but is actually struggling. According to the National Institute of Mental Health, it takes the average person suffering with a mental illness over 10 years to ask for help. But there are very effective treatments. Medications and therapy complement each other to boost brain chemicals. In extreme cases, electroconvulsive therapy, which is like a controlled seizure in the patient's brain, is also very helpful. Other promising treatments, like transcranial magnetic stimulation, are being investigated too. So if you know someone struggling with depression, encourage them, gently, to seek out some of these options. You might even offer to help with specific tasks, like looking up therapists in the area or making a list of questions to ask a doctor. To someone with depression, these first steps can seem insurmountable. If they feel guilty or ashamed, point out that depression is a medical condition, just like asthma or diabetes. It's not a weakness or a personality trait, and they shouldn't expect themselves to just get over it, any more than they could will themselves to get over a broken arm. If you haven't experienced depression yourself, avoid comparing it to times you've felt down. Comparing what they're experiencing to normal temporary feelings of sadness can make them feel guilty for struggling. Even just talking about depression openly can help. For example, research shows that asking someone about suicidal thoughts actually reduces their suicide risk. Open conversations about mental illness help erode stigma and make it easier for people to ask for help. And the more patients seek treatment, the more scientists will learn about depression, and the better the treatments will get.
Okay, so please, was that clear enough? Were we able to gather anything from that video?
Yes, ma.
Yes, ma'am.
Yes,
Yes,
ma'am.
yes, ma'am.
Yes, ma'am.
Okay, now
Yes.
I need to ask, I want people that actually listen to the video, I want you to tell me the difference between depression and being depressed. You can help us to state from the video, and what's the difference between being depressed and depression? That someone is depressed and the person is actually suffering from depression. There is a difference. So who is going to help us? Hello, who is going to bail the cat before we continue?
Hello.
Hello.
Yes.
Hello. Good
Good
evening,
evening.
ma'am. Good evening, ma'am.
Osareme, please go ahead.
Okay, yes, good evening, ma. Okay, being depressed is a kind of feeling. Maybe you're sad, you woke up in the morning, your car could not start, you want to go to work, you went to pick your children from school, they're giving you headache, and you can feel down that you are just depressed. That's not depression. Then anything can actually swing you out of that mood. Probably you are broke, you don't have money, you can be depressed. Then somebody just get an alert, they send you 50,000, all of a sudden you're happy. You were being depressed, not really depression. But depression is a medical thing that needs medical attention for it to be resolved to be resolved. So depression has to be diagnosed by doctor or by a doctor or therapist. That's what I really understand.
Thank you. Thank you so much, Osareme. That's a beautiful one. It means you listened and you actually watched that video. Thank you for sharing with us. So that's a beautiful answer. Like I always said, I'm glad the caliber of people, I have had trainings over the years, and I've seen different people. I've seen everybody, and I must say that I've really had value from this particular class, this particular set of CHCA students. Thank you so much, Osareme. Then, do we have any other person that has anything to add? I think I saw either the Xiomi or the Infinix who else wanted to add or subtract to what Osareme said? Any other person?
Yes, it's Helen, ma'am.
Okay, Helen. Helen,
Yes,
please go
yes,
ahead.
ma'am.
Yeah.
So from what I gathered, I just want to talk about the depression. Depression, just like my fellow student just said, depression is like a medical condition.
Okay, okay.
You
Thank you.
understand? Just like malaria, typhoid, and all other things that you go to maybe to the hospital for medical attention.
All
Yes,
right, all right. Thank you. Beautiful, beautiful, beautiful. Thank you so much. So that's just the A to Z of it. Being depressed, anything can happen. You may not like Helen that just finished talking. Maybe you need some dollars and hobby does not make the dollars available for you to do what you want to do. You can feel sad, you can feel depressed, But depression is a medical condition. It's a condition that needs medical attention. It's a serious thing. So that's just the difference between the two. So sometimes I've had someone ask me this question, please, how do I know if I have depression? Because I was depressed and this happened to me and this happened to me and I just smile because I know that there's actually a challenge. The people tend to get it twisted, but I'm glad that we were able to understand it. So that being said, let's delve into the rest part of it. Oh, I don't know what's happening. Not here. Please, I'm not fully not happy about this. Okay, please,
is it network? I'm not hearing. I don't know whether others are hearing. I can't hear anything, ma. Could it be network? Wow. This is something else. Maybe it could be the
I'm
weather.
not even hearing anything too.
I'm telling you. Nothing. Yeah.
Takes a little and just grab a cup of water. Okay, so let's get down so we can exhaust what we have. So primarily, this particular slide talks about symptoms of clinical depression. without the knowledge, maybe just hearing the awareness, and you may just say, oh, I'm often down sometimes. I'm often sitting down. Maybe I'm depressed. I mean, maybe I have depression, So, but with this, you can have an idea of what depression actually, the signs and the symptoms of depression. Now, if someone has, for more than 2 weeks, maybe counting, has been sad, down, or miserable most of the time, or you've lost interest or pleasure in most of your usual activities, you find out that there are people that used to be, on top of their game, people that used to be very active, they like social gatherings, they like to be where things are happening. That's where you see them, but all of a sudden you see them withdrawn. They don't like going out. They don't like interacting with other people. Everything put together as some of those signs. And you can see those two because those ones are major signs. Then you combine it with at least 4 of these other symptoms, weight loss or weight gain or changes in appetite. These ones are the secondary symptoms, while the other 2 are the major primary symptoms. Okay, so like poor concentration, indecisiveness, or model thinking, recurrent thoughts, and a whole lot. So having the two primary symptoms combined with at least 4 out of the secondary symptoms, the ones below, weight loss and all, sleep disturbances, lethargy, restlessness, all those ones put together would help you really know whether you have whether there's a cause for concern. When you see all those things, that's what will help you decipher and know whether it's actually what it, or if what you're actually experiencing or someone is experiencing gives you cause for concern. That is what is there. I just trust that we are all back. Let me see the number 17. Okay, but we will not be able to wait. So others would just have to join us and make do with the slides and voice recording when they get it, because we just have to move. Our time is moving very fast. So as I was saying, these are the primary and then the secondary symptoms of depression. Okay, now we have what we call the DSM-5 criteria, Diagnostic Statistical Manual. That is what the full meaning, Diagnostic Statistical Manual. Now, it is guidelines. It's a manual that contains the guidelines and how you can diagnose depression, mental illnesses in general. So according to it, depression, you have to see some symptoms. It needs to be present for at least 2 weeks or longer. And there should be no major known association with loss. That's no loss, not a part of a normal grief process. Because, when you lose, God forbid, for someone that loses a loved one, normally and naturally you grieve. Grief comes. And also it's important for us to know the difference between grief and depression. The two are not the same. Now, not due to a general medical condition and not due to the effect of substance, maybe drugs, alcohol, or medication. Now, holistic to decipher between grief and be lenient with us. This does not significantly interfere with your grieving over the loss of something very important, or a person, or maybe property that's worth lots of money. Maybe you are grieving over something like that. It would not. It does not significantly, that seriously interfere with your ability to do the normal things you used to do. Maybe going out, maybe going to work and doing some things. It will not have a significant, take note, it may, but it wouldn't have a heavy interference. It will not seriously alter your ability to do these things. That's grief. Now, again, it will not significantly impair family or social activities, like I said, where you as a person has previously been purposefully engaged or purposefully engaged in. It will not. So there's a difference between grief and depression. It is important that we don't get it twisted. We don't get it twisted. We just need to know. Grief is maybe passing through something, maybe mourning someone or a loss of any property or anything like that. But depression, like we already said, it's something that takes at least 2 weeks counting and getting worse. And then all the symptoms are there heavily. It affects your ability to interact. You know how depression comes. When someone that is actually having depression, you see the person, maybe if it's a lively person that is always on, is always the light of every function, carries everybody along, lights up a room when he or she enters and a whole lot like that. All of a sudden, the person coils, withdraws, goes back into his or her shell and likes to stay, like we talked about, silence. Now likes to be in solitude, likes to keep to himself. When you start reading these signs, it's very important that we understand this course, because it doesn't really mean that you have to exhibit these things lens with your patient, like I keep saying over and over again. You may have a husband, or maybe a husband on this platform. You may have a wife that all of a sudden, you know better. Nobody knows a wife as well as good as the husband, or vice versa. So all of a sudden, you now see that this my husband is he always goes out with friends, he's always happy, he's full of life. And all of a sudden, you just start seeing him exhibiting some signs, keeping to himself. He doesn't want to go out. He feels as if the world is coming to an end, and a whole lot withdrawn. The activities he used to enjoy, he starts gradually losing interest in them. It most, of course, depression is not just something that is a gradual, it keeps going, it's an illness, like any other illness. If it's not treated, it keeps degenerating. It keeps going worse and worse and worse until it becomes worse. You understand? So I tell people that many people that commit suicide, we'll get to that side anyway. Let's just move on. We'll get to suicide. I'll talk more on that. So we also have referral pathways. When you observe these things, you as a healthcare practitioner, is to help. Referral pathways. You help a person when you sense these things. It could be maybe your loved one, it could be maybe your friend, it could be maybe at the place of work. When you sense these things, there are things you can do. Referral pathways. You cannot outrightly conclude. You cannot give a diagnosis. That's very important. You can never at any point, even with these symptoms that DSM had made a diagnostic statistical manual has actually showed us, you cannot by yourself, if you are not a practitioner, if you are not a specialist, if you are not a if you are not in charge, you're not a general practitioner, you don't deal with these people, mental health professional, you cannot just stay on your own and say, this person has depression, the person has not just been talking to me and all that and all that. No, you sense these signs. The reason you know these signs is so that when you see these things that go out of the ordinary, you now move towards the referral pathways. You see how best you can use your knowledge to help this person to seek help before it gets worse. That's the idea. Because as you have this training, of course, it doesn't mean you automatically be able to attend to maybe you work in it's not all of us that work in psychiatric facilities, you understand. So there are many things that we need to know. So when you know these things, you can help people. You can help. You refer them to mental health professionals. You refer them to people that are specialists in that area. You refer that person to a specialist so that they can use all the knowledge within their disposal and carry out the necessary tests, like you saw when we played that video, to actually ascertain that this person is going through depression, clinical depression. That is why you need this knowledge, not to treat, but to do what is right, so that it does not degenerate and that person does not metamorphose into a state where the person will want to end it all. Like we are having series and series of people actually doing that, maybe jumping into Third Mainland Bridge, killing themselves, taking one thing or the other. You just hear every day. It hurts me, it breaks my heart, really, when I see these things, when I see them on Facebook, when I listen to news. Some time ago, sometime, I don't really want to, sometime, I saw a very beautiful lady. Oh, when I looked at her, if I say somebody is beautiful, the person is beautiful. A very beautiful lady I saw. And what happened? I was told the lady committed suicide. Why did the lady commit suicide? That whether the husband ran away or the boyfriend did what? Something in the line of that some years ago. And it hurts me real good. I don't know the lady from anywhere, but I felt so bad up until now. Anytime I remember, I was like, can you just end your life just because of, I don't know. I don't really know. So we should learn to take things on the surface. We should not be too into things, because if you are too into anything in this life, it becomes an issue. So I don't know. I wouldn't know. I cannot judge the boyfriend or the husband or whoever, and I cannot judge her because I never heard from her. But why I'm just saying that is that we keep losing people because of one thing or the other in the line of committing suicide. Who knows? That lady must have been suffering through passing through something. She'll keep quiet, keep it to herself. She cannot tell. She'll weep in her room, flog herself, do everything she wants to do. At the end of the day, that happens to her. And whose loss is it? Of course, you know the person's loss. Needless to go into it. So what are we trying to say? You can refer, when you see certain things that are not ordinary, refer them to appropriate quarters. Never you give a diagnosis. Never you, when you see someone come to you, maybe tell you, I have this, I don't just, oh, I've been passing through a lot. I noticed this, or crying, I've been crying, or my mood is like, or you yourself, you observe it. What you can do to the person is to refer the person. And when you are even giving that, don't go and say, oh, Mary, I brought Mary. Mary is actually having is having depression, or Mary has anxiety disorder. If you say that, then that's wrong to say. You don't have the right to diagnose. It's for you to refer the person and let the test be carried out of a truth. When the test is carried out, it will be they will take it up from there. You have helped the person. You have saved a life. You may not know. People that actually do these things, that help people, refer them, give people shoulders to lean on when they are undergoing one thing or the other. You don't even understand the weight of what you have done, because you just do it like that and you take it for granted. But the truth is that you have saved a life, and you have saved so many other things that would have resulted. If peradventure, maybe help did not come, that person decided to end it all, God forbid, maybe. Do you know the weight, the pressure of that? Do you know how it can spread like an umbrella, spread out its tentacles? Maybe the loved ones, you know how affected they will be. Do you know how the environment, and a whole lot of that? So you see that just one right move for you to help someone, you can go a long way in saving the society. That is the truth of it. So that being said, let's move. Please remember, any question, feel free to ask. If you don't ask me question, I like to talk. I can talk, especially when it comes to mental health. Oh, I can talk. I can really, really talk and sit there, because it's a passionate. It's something I do with passion. So please, if you have question, drop it, or you can still raise up your hand. I'll see, so that I don't monopolize the training. So now, supportive counseling too, clarifying myths about depression, psychoeducation. There are a whole lot of things. Counseling, therapy. Therapy sessions can be organized for them, a range of therapeutic techniques, cognitive behavioral therapy, CBT, relaxation techniques. There are people that believe that, okay, I have seen something in the chat box. Okay, all right, thank you. Osareme, please write on. Maybe you have something to contribute.
Okay, I don't know if it's a
Go
contribution
ahead.
or it's a question, but let me just say,
Okay. However,
there
go
are
ahead.
some situations where some persons can bear pain. It's very, I used to say a lot of people cannot bear pain, so they end up doing something to themselves. Do we term that as it was depression that led them to do it? For example, I know someone that the husband was having an affair outside, and at the end of the day, just to punish the man, while he was asleep, she cut off his penis. And
Jesus.
so people were like, what must have led us to do that? They said it's pain. A lot of people don't know how to bear pain. A lot of people cannot bear pain, unlike our mothers or this. But she's having a GSM right now in Benin. So do you system that one as depression?
Okay, thank you, Sarime. Thank you so much. First and foremost, I want to say something. I want to start by saying that before, believe you me, before it got to that, it metamorphosed to that state where she actually carried out that act that she did. She must have, since you said you are her friend, I don't know, someone you know, I think you can attest to the fact that she has not been finding all those things funny. As in, it's not something that starts when it comes to infidelity in marriage. It's not something that starts just, I don't know how to put it. It's something that maybe there is a reason. There is a reason the man has been doing whatever he has been doing. You understand? So maybe she has been talking about it. Maybe it has been affecting her. It has weighed her down. It has demoralized her. It has brought down her self-esteem. It has, I don't know the words, the right words, more words to use to be able to express how that feels. Because I know how, at least I can paint a picture of what she must have been going through. In as much as I don't support that, taking it to the extreme, but believe you me, I cannot say, just as I said, that there are statistics that has to be looked at before you can say that a person has depression. So right now, I cannot tell you, yes, it's depression, or no, it's not depression. Because finally, how you get to know and ascertain to a large extent that a person has depression is when the specialist, the therapist, when the GP, actually carries out his or her assessment on that patient to be able to say, oh, based on this statistics, this person was actually going through depression. But for a woman to be passing through that, the chances are 60% or to 70% that she must have been undergoing depression, because it's going to be a chain of events. I don't think that a man that just maybe gets funny one day or two can just make a woman gets angry, or I don't know, to the extent of doing what she did. No, it's not a day's thing. That's what I tell people. It cannot be a day thing. It's something that has built in her. Before she even carried out that act, she has been depressed over and over again. Perhaps it has even resulted into depression, and she doesn't just know what to do. She just got up one day and decided to say, this man, let me end it with him, so that when he gets to the other side, he will now go and explain why he went like that. I think so. I'm not speaking for her, but that's just the truth. We cannot 100% say it's depression, but those are some things that can result when someone is undergoing depression. It's either draft to keep to yourself, leave him. Like in that case, still okay, no problem. But you keep flogging yourself, you keep being your self-esteem tampered with, your self-esteem destroyed, and keep managing
No, endo. Mm. General network. So the airport.
What is happening to you? Wow. Network is going to stop everything now.
Well, it will not be in vain. God.
Sure, sure. Sure.
Network. What is this? The weather, I think it's raining here, and I think everywhere. That's why the network is so bad like this. It wasn't like this yesterday. Network was a little bit better than yesterday. It wasn't this bad. Sir?
It was like this, so only that wasn't
Okay.
as worst as this.
Yesterday, my head, network.
Mm.
My
Yesterday,
head, the
too, I could
network
not take
wasn't.
all of the lecture because of that network
All
stuff.
right. All right. Sorry. I think we are back. I was lost. Network dealt with me. I just want to rush, and
The
so we see
problem
how
now.
to get
Okay,
it.
no problem.
To see how to get it. Sorry about that. I don't know. Today is just ATL, MTN, everything. I don't know what is happening, but we'll just do what we have to do. So, Osareme, I don't know if I was able to. Osareme, are you still here with us?
Yes, ma'am, I'm here.
Okay. So fine. Like I said, I wouldn't say 100% that it's depression, but there's every tendency that it could be. It could be that woman must have seen a lot, and over time, more than 2 weeks, she must have gone through a lot, bottled up before she decided to do what she did. So may God help us. So where is she? I didn't hear the end. You said she's now somewhere, right?
She's serving his exam in Kirikiri.
Okay, all right. So
Yes, the sentence teacher.
it is well. It
She's
is
not
well,
my
it's
friend,
well.
actually.
Okay, so okay, so let's go ahead. Now, medication myths. Let's move before the thing will network. I don't know what's trying to do. So, depression is natural. These are some of the myths still continue. Some people think that depression is natural and nothing can be done about it. People think medication won't be able to help, and a whole lot of some will say, okay, if they start taking medication, then they'll become addicted to it, and so on and so forth. But that's wrong. Some of these misconceptions are not actually the way people are making it seem. Medication can help, and it does help. It will help restore the chemical imbalances. I did say that it has got to do with the brain. So when someone has mental illness, in fact, anything you do, you get the sensory neurons from the brain. It gives you the information, tells you when to go and ease yourself, tells you when to, and a whole lot of things. So it would help to restore, to work on the brain, and it does help after all. So the best thing you can do is to refer people that actually have these challenges to appropriate quarters so that Yeah, the challenge can be nipped in the bud. So right now, we want to look at anxiety. Anxiety, this is another one. Anxiety. Nena, I'm so sorry. I've been trying to, when we had the break, I tried to reach out to you and you didn't, perhaps you weren't with your phone when we had break. I don't know what's happening. Network is equally challenging over here. Today is just a very funny day, you know, with all the networks having challenges. So don't worry. Like I said, you'd have access to the recorded versions. That is, we don't say what we don't do. At the end of the day, you would have the recorded version. It's just that it takes time to make sure that everything is drawn and put in place. I mean, that's why I do send the slides first, way for you to be able to go through so that the recorded versions will just help you. So now we are looking at anxiety. Anxiety is the third module, and we'll just see how to go around it. So what is actually this anxiety? What do we mean by anxiety? Anxiety is different from grief, is different from depression. So it's important for us to know that there are differences. Okay, so let me take it back to the, so that you'll be able to see. Good. So anxiety is a normal, healthy reaction. It's healthy. Everybody gets anxious at one point or the other. Everyone gets anxious. It's a normal thing, you know. So if you are anxious over something, if you get anxious, that's anxiety. Do not think that there's anything wrong with you. No. But when it becomes too much, it becomes severe, that's when it is called anxiety disorder. That's when it becomes a disorder. But everybody, regardless of who you are, regardless of your academic attainments, you know, there's always that element of being anxious when you come face to face with any challenging situation. It is normal for everybody. So anxiety is a normal, healthy reaction. It happens to everyone when you are confronted with certain life situations. And then it occurs when there is perception of threats or danger to your physical or psychological well-being. It just comes, you know. So but moderate anxiety can be useful and energizing, as I said. Now, anxiety is simply a normal response to stress or perceived danger. When you are stressed, you become naturally anxious. Anxiety sets in, or perceived danger. You have perceived something that is dangerous, you know, something that poses as danger to you. What follows is anxiety. And there are different types of anxiety disorders. But when anxiety becomes more serious, that is when it becomes a disorder. When that anxious situation or that anxiety becomes more intensive, it lasts longer, it leads to development of fearful behaviors that limit your ability to relate to environment. Some people, out of anxiety, it limits their ability to carry out certain tasks. It limits their ability to function effectively because of that anxiety disorder that they have. They have not been able to overcome the natural anxious state that everybody can, you know, that everybody can relate to. So at least one major area of a person's social functioning is affected when you are anxious. At least one part of your functioning is affected when you are actually anxious. Good. So now, how common is anxiety? Now, anxiety disorders are the most common form of mental illness found in the population. Take note, anxiety disorders, they are known as high prevalence mental illness. That is highly prevalent. Half of these experience the other high prevalence disorders like depression. We have the depression that we just talked about and so on. Or substance abuse disorders. Remember, we talked about comorbidity, a situation where someone has more than one mental illness. Maybe you have the depression and you have the anxiety as well. Now, emotional symptoms of anxiety: persistent worry or fear, feeling overwhelmed or restless. These are some of the symptoms. Difficulty concentrating. These things come with anxiety. Increased heart rates, sweating, trembling or shaking, fatigue or sleepless disturbances. These are things that come with anxiety. Now we have the different types of anxiety disorders. We have the GAD, that's the generalized anxiety disorder. We have the panic disorder. We have the phobic disorder, fear of, maybe there are some people that have fear of, I've forgotten that particular name, phobia for heights. I've forgotten it, has just skipped my head. Phobia for heights, like people that travel, maybe take get into an airplane for the first time, they are bound to be anxious. They are bound to have that as a result of the fear of heights. Some people have phobia for heights, like I said. Then we have the PTSD, the post-traumatic stress disorder, obsessive compulsory disorder. There are a whole lot of disorders. I don't have to bore you with all this. If I delve deeper, I'm going to be touching the medical jargons that will further confuse some of us that are not medical practitioners. So let's just look at one or two of them. You understand, like PTSD, most people post-traumatic disorder, people that have actually faced one very heavy traumatic incident in their lives, very traumatic incidents. Most times people that have maybe been raped when they were much younger used to pass through this. They used to have this PTSD, like they were forcefully raped, maybe at a tender age, and they have not been able to access therapeutic therapy. They have not been able to tell anybody, because the worst kind of thing is when you pass through these things, you are not able to speak out, you're not able to share, you just bottle it up. Stigmatization. Oh, they will say, that girl, you see that girl was raped, she said she was, all those things. So there are a whole lot of things that is going on in our society that needs to be curbed or nipped in the bud before it gets out of hand. So this PTSD happens. I did say it when I had this mental health training sometime, that one of my friends actually had armed robbery attack, So armed robbers attacked her house and their husband wasn't around, and what she passed through. And how did they enter the house? They banged on the door severely. They used the arms they had. They hit on the door. You can imagine, boom, boom on the door, the sound. And every time she was afraid. She was scared, she was shaking and all that. And they actually robbed and did whatever, carted away some of the things and all that. So after that, she has not healed. For a long time, she has not healed. Even up until now, she still comes to visit me. If she gets to your house, there was a time she came to my house, it was almost that Christmas time where, knockouts, even though they have stopped it, someone threw knockouts and she had the sound. If you see the way she reacted, I mean, after many years of having that accident, many years, her incidents, it keeps coming back, it keeps playing out. So these are some of the things: traumatic stress disorder, things that people have actually faced that have really stabbed them very hard. It causes anxiety, it makes them to be anxious. So these are some of the things. Now let's look at this picture. I hope network will favor us. Please, can you hear me? Are we together, please?
Yes, we are.
Yeah. Kind of.
Mm-hmm. Okay, so please, like I said, so that we can meet up with network and meet up with the time, please just do end and then I'll ask you, or not. That's why I think that's my this trainings. I get to hear people really share a lot of experiences that help me, to understand, like to know more. Nobody's an embodiment of knowledge anyway. So I learn as I keep doing trainings, I learn from distinguished and seasoned professionals as I have on this platform. So feel free to share whatever experience. Just feel free to tell me one or two things. It's important that we share, because someone can learn from your own experience, not even me alone. It's important. So at any point you have any question or any contribution, please, you can go ahead and ask in the chat box, or you raise up your hand and I'll call for you to. So let's look at this picture. How does my body react when anxious? You can see a whole lot of things going on. Mind racing, possible disturbance, blah, blah, difficulty in swallowing, and a whole lot. Now, I want to give you, in the next 2 minutes, I want to tell you something, a story, okay? Madam Ogoeze, thank you so much. Please, we are free to contribute, because I know you may wish to contribute to that. You're a specialist. Go ahead.
Okay. No, this is not about specialist. It's about an experience.
This is not about specialist. Okay.
It's not about. It's about experience. Even Jovita
All
here
right.
knows what.
Okay.
When I told you that I was not feeling fine, some people, I started noticing my BP was going up. Do you understand?
Yeah.
BP was going drastically up, and it comes with palpitation. I would just be
Yeah,
so that's
palpitations.
palpitation at rest, not palpitation with stress. So it may have something to do with stress, but most times patients have palpitation when they have overstressed themselves. But mine
Yes,
is
you've
at
explained.
rest. When I'm sleeping like this, palpitation will wake me up. Do you understand? So
Wow.
I met the cardiologist. I decided to just go to the heart doctor straight. So I met the cardiologist.
Mm-hmm.
When I met him, I ran all the tests, did scan, did all those heart tests and everything. Nothing was detected. Just that the palpitation made my ECG to be abnormal. Then he keeps telling me that,
Okay.
what is it that is bothering you? That
Mm-hmm.
your heart is okay, but you are
Mm-hmm.
anxious. You are anxious. Something is wrong with you. Because there was a day I took all the drug. It made me to be on antihypertensive drug. I don't know whether all of us will
Wow.
understand that drug. So he now said that
Oh. Hmm.
the rate at which I'm having palpitation is too much. So that it means something is happening to me because my heart is okay. So he's trying to face it. And he now said, no, palpitation at rest shows that it's something you need to work on yourself.
Yes,
Even I came to
yes.
Jovita. Jovita was one of the advisor that I have. So I now started looking at
Okay.
this. I now started looking at myself. I now noticed that I have a lot of load on myself. A lot of load, a lot of thinking. I had to tell myself the truth, a lot of thinking. Whenever anything happened like this, PM in my family, I'll carry it on my head. Anything happens, I carry it on my head. So it now makes me, my body have absorbed more than I can take. It started giving
Your
me that.
mind will start boom, boom,
It
boom.
started giving me that signal.
Yes.
I will stay like this. I start having palpitation.
Yes.
If my heart is hitting, I'm taking losartan. I'm sorry I'm diverted, but most of us may know.
Signals.
And we're here. I will take losartan, amlodipine, and carvedilol. These are 3 drugs I combine before I can even see road. But you know, when I worked, despite that I'm on drugs, I worked on myself.
No. Go ahead. Go ahead.
Yesterday, I did, throughout this week, I noticed that
Jesus.
my blood pressure had been very good. In fact, I'm afraid of taking the drug. I had to write to the doctor, said, I've been getting 107, 110, 150 over 65. I'm afraid of taking this drug.
Wow.
He now said, thank God I called him, that I should reduce it to 1 in the morning, 1 in the night. Do you know what the secret of what I did? I worked on my diet.
On yourself, yeah, on your diet.
I work on myself and my diet. If I take Pepsi or Coke, I won't get myself. What I'm saying is that some people say BP is not in our family. It's a lie. Anxiety is not in our family. It's a lie. Madness is not in our family. Not lie. Yes. All those genetic traits, yes. Family traits can come. But you yourself, when most of us have reached 40 and we cannot rest,
genetics.
Yes, anything you see. Now, it's not everything I put in my mouth. And I noticed that in as much as I have those drugs, my eating habits and everything have made me now that if I this night I'm not going to take drug because it's already 107 over 65. If I take drug, it will drop. It's not normalizing. So I know most of us here are more than 35. Do you understand?
Yeah,
anyone
that's right.
can do. Let us do it. The one that will not work,
Leave
let's
it. Jump it and pass. Jump and pass.
It's an experience. Let's leave it. Don't say this is not in my family. Just work out on how you will help yourself. Whether all your great fathers, when they died, did you know what killed them? It's only the people we saw that we know. If you say genetics, you don't know what killed your great grandfathers, which is true. Please, I know I'm digressing, but I said let me say it. This anxiety, me, I didn't want to. When doctor said go, you're anxious, and I said, are you saying that I have anxiety? He said no. I said you are anxious. Your heart.
Yes.
Yeah, remove your mind from so many things. You will be better. And immediately I did it with advice I got from friends. I'm much better. Seriously. Thank you so much.
Thank you. Oh, Madam Ugoeze, that's a beautiful one. Thank you for bringing that. Still boils down to what we said from the start. Anything that will affect your mental health. You see, like you talked about carrying things. See, our body is very, like we talked about homeostasis. When there's a shift, our body adapts to things. Now, if your body is already adapt to the fact that you're always receiving news of this, of that makes you anxious, your body will, in a way, begin will now, how do I put it, channel towards that direction, be stereotyped towards those particular challenges. So it's very important. Thank you so much, Madam Ugweze, for sharing that with us. You see, this training is always beautiful when people share, because it's not everything I would be able to say. So I have learned from her, as well as I trust most of us, if not all of us, have also learned from her. So now, this is a clear picture, what we are seeing now, of someone reacting when anxious, as in how your body reacts when you are anxious. So many things can come into play. Difficulty in swallowing, head racing, a whole lot, as you can see here. Like, I like to tell people this story. Some time ago, I was asked to, before I actually, had the right knowledge and everything, I was asked to, one day, I don't even really know what happened. I was asked to actually deliver, make a presentation, for people, So I was prepared. I was actually prepared, because I know when I'm passionate about something, I was prepared. But surprisingly, when I entered the hall, that's what I'm trying to tell you, that anxiety is normal. It's only bad when it becomes out of proportion, when it gets severe, when it goes metamorphosis to become the full-blown anxiety disorder. That is when it becomes a problem. But just ordinarily you fidgeting. So I was to make that presentation. I had practiced, I had rehearsed, I had done everything that I knew how to do best. I was like confident that I was going to deliver. But an hour to that presentation, I don't know what happened. In fact, when I even walked into that hall, I was ushered into the hall. I sat down. I was ushered into the hall. I sat down, in preparation for what I wanted to do. All of a sudden, I just became anxious. I became my hands. I was sweat, my palm, not hands, but my palm. I was sweating profusely. In fact, I was trying to find out what is actually wrong with me. I was asking myself, you that have been, even though then I wasn't the way I am now, like, so, with education comes a whole lot of things. So as at that time, that was far back then, that should be about my second presentation. I just felt my hands were sweating. I was having headache all of a sudden. My stomach was having butterflies, as if the butterflies were suddenly having a party going on in my stomach. At that time of all times, they were having discussion in my stomach. I did not know what to do. I was totally confused. The paper I carried the paper. The paper was shaking. My hand was shaking. The paper was shaking. You see this drama that I'm trying to. It's very funny anytime I remember. And up until today, I still wonder, if not for the knowledge I have, I was seriously anxious. It wasn't a disorder, because a disorder is when it becomes persistent, when you cannot handle it. But what happened was that all of a sudden, I just took some of the techniques that I could lay my hand on at that particular moment. Immediately when that thing happened, because it was few minutes to, and when it grew closer to when I knew I would be called, because there was a program, an order of events. So I saw it when they will soon call me, to come out. So when it went closer, it was as if it was worsening. It was worsening. The situation was worsening. I was sweating. And then I stood up. As I stood up, could you believe it, that my knees, my two knees, turned to jelly. I don't know how to put jelly-like legs. That's as if my legs could not carry me again. As if I just wanted to slum. I stood up and I was like, Jesus, why is this happening to? Is it my village people that have finally caught up with me? I didn't know what to do. But at that point, I decided to do some. I just remember, I said, let me breathe in. I took a deep breath in and then let out. I did it like 3 times. I was able to get myself to put myself together a little. And you know what? When I climbed the stage, initially, I was tutoring. I was like holding the paper, and the paper was like trying to, I said, I cannot afford to disgrace myself or embarrass myself at this juncture. Whatever anxiety or being anxious is, you just better fly away, because I have to do what I have to do. And with that breathing exercise, I took time. I breathed in, I breathed out, I told a joke, and everybody laughed, and the atmosphere was like relaxed. And, gradually I saw that I was coming back to normal. I was coming back to normal, and I delivered that presentation. Nobody, not even one person, I believe, sensed anything like that in me, but I knew the drama and what's the party that was going on inside me. So what am I saying? These things happen. There is a difference between the normal anxiety versus the excessive anxiety. The normal anxiety can be beneficial. Like I said, it helps us respond to challenges. Like when you are preparing for a test or a job interview, like what I said, maybe you want to give a presentation and you are, that's occasional anxiety, which happens to everybody, I think, and I know it happens to everybody. So, but the excessive anxiety is when anxiety becomes persistent and interferes with your daily life, your relationships, or your work. It may indicate an anxiety disorder. And again, there are specialists that look at that. You need to go for therapy if you are that kind of person that it occurs every time. Anytime you have to face a crowd, every time you have to give any presentation, or you have an interview, or you are taking a flight, you are just full of anxiety, you are just anxious, then you have to, there's a proverb that says you have to look for a black goat in the daytime. So you don't have to wait until it's dark because you will not see the goat. So when you sense these things at the initial stage, you monitor to see if it is persistent. Then if it's persistent, you have to act fast so that it does not become a disorder. It doesn't become an anxiety disorder. Very important. And sometimes it could be because genetics and brain chemistry can play a role in this anxiety. Stressful life events, like I talked about, if you have passed through a lot, people that have post-traumatic stress disorder, I still repeat, passed through a lot, or you've been in the war, people that have had pressure to their brain, so maybe you've been hearing loud sounds, maybe like gunshots. You find out that most soldiers, when they retire, they have that issue. They have that PTSD. You need to take them for therapy, for them for constant check and all that, because they are used to, especially those that fought the war, gunshot, being afraid, shaking, all those things build up. And if not properly handled, they can metamorphose into another thing, because even when they grow, even when they have retired, they still have triggers of those trauma. The trauma triggers them and they become anxious. So that's PTSD, post-traumatic stress disorder. So impact of anxiety. Anxiety can affect your performance, your work performance, like I said, your relationships. Chronic anxiety may lead to physical health issues. You can have headaches. You can have digestive problems. You can have weakened immune function. It's a whole lot. It's a whole lot when we talk about that. So let's look at stress. Let's look at STRES, stress now. Stress occurs. Stress, this is where we'll talk, because most of us, we stress ourselves. Let's come to think of it. Stress can cause anything. Stress can cause, I don't know, any kind of illness. Sometimes when you get to the hospital, you visit a doctor, the first thing the doctor will say, you need rest, you are stressed, you need rest. And sometimes people that are not in it will say, what has rest got to do with this? Maybe if they have malaria, they have this, say, how has rest? What has, in their minds, they won't say it to the doctor, but in their minds, they say, what has rest got to do with the malaria I have, or this and that, stress. So bad stress is not, especially bad stress, because we are going to see that we have the good stress and then the bad stress. Please, are we together?
Yes, ma'am.
Okay, so let me write on.
Yes,
We are almost done. I crave your indulgence. We'll soon finish. Just as I said, any question, anything, drop it in the chat box, because network is not too friendly today. Let's at least exhaust this module. We can't carry it forward to next week so that we'll have time for practicals. Thank you for your understanding. So now, stress. Everybody feels stress, and most of the time we respond automatically to stress. That is, it's just a natural tendency. Automatically you respond to stress when you are stressed, when you reach your limit of elasticity, like the scientists will say, it's just like an elastic. When you strain the elastic, you pull it, you can pull the elastic to the point where you cannot pull it again. That is how it is. It gets to its limit. So that's how stress is. So when it gets to its limits, it comes with consequences. Understanding the stress is very important. We have the good stress and we have the bad stress. The good stress makes you alert. The good one is the one, maybe you want to meet up a deadline. Your boss says he needs those documents by 12, and you're trying to see how to meet up, to perform optimally. For example, when you are working towards maybe a deadline or playing sports, or maybe you are running, you are under stress, you are running, but you have to finish well with a good position. These are stress that we can say good stress. Now, we have the bad stress. That's the one that can sap your energy. When you reach your limit of elasticity, it can sap your energy. So people are, it arises when you work beyond your capacity, your individual limit or ideal level, because my stress level My limit of elasticity will not be the same as that of maybe Aminat or Madam, Abidemi. It may not be the same because we are different people. Please, Remo, please, can you help us? Remo, Aminat, thank you. Help us to mute your mic so that we can move. So, thank you very much. So, sometimes we all have our different capacities. I can walk optimally, just like I can talk. There are people that are not very good in talking. You cannot even talk to them too much. I have a friend like that. No matter how you try to bring up a conversation, she just gives you monosyllabic answers. Yes, no, did you eat? Yes. Did you go there? Yes. How was that? Fine. She doesn't know how to. So we are all different people, and as such, our stress levels, our limits of the individual limits are different. Our capacity, what we can carry, different also. So let's look at stress curve. Okay, we have a message in the chat box. Okay, all right. We are going to attend to that. Now, we'll get back to that. Optimal arousal. I'll get back to that question, please, whoever asked it. Now, we have situations. Now, stress curve, understanding the stress curve. Now, what we have here is the stress curve. Now, in the stress curve, I want us to, outside looking at this now, let's look at how it slides and how it's looking at this. We should be able to understand how the stress curve moves. Our body is, how do I put it now, so that we will understand those that are not in the field. Now, our body has a limit. The limit with which we work, the limit with which we can do something varies. Now, in the stress curve, it's a helpful way to visualize how stress affects our performance. That's what we are going to talk about now. The stress curve diagram, like you can see here, the stress curve diagram, it's telling us how at each point that we do anything, how it affects us, or what part does it play in our lives? What happens to us when we are stressed? Now, look at this graph. We have the horizontal axis. We have the horizontal axis and we have the vertical axis in this curve. Now, the stress curve is a helpful way to visualize how stress affects our performance and our well-being. In this graph, you would see the low part of the graph. We have the horizontal and we have the vertical. I want us to understand the horizontal is like you are lying down in a lying position, a person lying down. So it's the down. And then we have the vertical, which is like you writing number 1. That is the vertical. Those mathematicians on the platform understand. Now, the stages of the stress curve. Now, the stress curve has the low stage. That's where you have the low, the LOW. The low, that's the left-hand side of the curve. Now, at low levels of stress, we may feel relaxed and unmotivated. When we are not stressed, we are just there within our comfort zone. We are not affected or motivated, or nothing is stressing us or disturbing us. This is very important. Now, at that point, we are relaxed. We feel relaxed. We may not be challenged enough to perform well or take action. You may not be challenged enough. You just take your time and do that thing. There's no challenge. Nobody. Think of it as being maybe on a lazy Sunday. You are comfortable. Maybe a bit unproductive. You are not really doing anything, rushing, meeting any target or anything. That's the low position. Like you can see that graph as it slopes down. Okay. Now, optimal stress. When you move up, you continue. You see that point where we have the optimal arousal or the optimal performance. At that point, as stress increases from the low, it keeps going up. This is where, at that optimal point, this is where you feel energized and motivated. It helps you at that spot, sweet spot. It's normally called the sweet spot. At that point, where you have the optimal performance, you are optimally at your trying to do what you know how to do. I was thinking that network. Can you hear me, please?
It's
I
cracking,
can
ma'am.
hear you, ma'am.
Yes,
ma'am.
yes, can hear you.
Jesus.
We can hear you.
Okay. All right. So as I was saying, I think network is trying. Oh God, please let's finish. So it is the sweet spot. It's normally called. This is where you feel that particular spot helps you to focus and to perform at your best. Like maybe the excitement before giving a presentation. Remember, like I talked about before giving a presentation or starting a new project or moving into a new house that you've been building for a long time. We feel engaged. We feel engaged and ready to tackle challenges. This is very important. So now the high stress, we've talked about the optimal stress. We feel engaged and ready to tackle challenges. That's the optimal stress. And then we have the high stress. High stress, that is when you are stressed, you have reached your limit. We tell people many times, often we tell people that they should try as much as possible not to be overly stressed, because when you are overly stressed, you wouldn't be able to function the way you should function. That is the truth of the matter. I tell people that when you get to that point, when you get to that particular point, that you have reached your limit, don't pretend that you can still hit target. Just rest, just take a break and relax. Because when you have reached that point, you are stressed beyond measure, it has reached your limit of elasticity. There is no point for you to continue doing that thing because it will have health implications attached to it. So when stress, we are looking at the right-hand side now, where you have the high stress, the right-hand side of the curve. When stress level becomes too high, we enter the zone of distress. That is just it. It doesn't become work again that you find funny. You are just distressed. That is just it. You just become, you can't perform beyond that particular point. So in this state, you feel overwhelmed with work, anxious or unable to concentrate because you have just reached your limit. Your performance declines. It just keeps going down. You cannot have perfect performance at that point where you are highly stressed. That's what it's trying to say. So our performance declines and we may struggle with decision making. At that point, you'll be struggling. Should I continue? Should I not continue? You'll be struggling to actually do that because you are tired. That is the word. You have reached your limit. So it's similar to the feeling of being in a traffic jam. For instance, now, like those of us in Lagos, yes, we know Lagos, that is always busy. Everybody seems to be in a hurry in Lagos. And as if the whole world will just come to an end now and everybody is busy. That's how Lagos is. I'm not a fan of Lagos because of that. I don't like too busy, a place that is too busy. So when you are in a traffic jam, when you are already late, these are some of the things that you see when you are already late for an important meeting, stressful and unproductive. That is the level you are, a level of high stress. So now it is important that we have a balance. It is important that you strike a balance in anything you do. Balance it. That is what I'm trying to say. Finding a balance. Now, the goal of finding this balance is to find that optimal level of stress where you can perform effectively. So you have to balance the two. This side, the low side, the high side, you have to balance it because it's at that point that you perform optimally. Now, where you can perform well without feeling overwhelmed, it's very important. You need to know that particular point in your life because you know yourself. We all know ourselves. So when it gets to that point where you get the signals, then you know exactly what to do. Managing stress, recognizing when we are moving from optimal stress to distress is crucial. Stress to distress. Do not move from optimal stress to distress because when you get to your most strained point, it becomes distress. It becomes a distressful situation. Very important for us to know that. Good. So we also have the acute stress reaction. It occurs when symptoms develop due to a particular stressful event, maybe as a result of a severe traumatic event or that we talked about. Maybe you've you've had issues of maybe a person raped while a person was young, serious issues, that's acute, serious stress reaction. Now, you cannot, like I said, symptoms usually develop quickly over minutes or hours, but usually settle fairly quickly within days or weeks. Now, for you to know these things, like I said, if you have acute stress reaction, you are stressed, acutely stressed, maybe not from work this time, maybe stressed as a result of a stress reaction of something like that PSTD we talked about, post-traumatic stress disorder, that we talked about, it keeps coming to you. Such a person that has that particular challenge, you should seek a GP. You should a general practitioner. You should seek help before it gets too late. Because if it continues in that trend, we all know the result of what could happen. So what are some of the symptoms? Anxiety, low mood, irritability, emotional ups and downs, and a whole lot. Flashbacks. You can have flashbacks. You can have reckless or aggressive behavior that may be self-destructive. It could result to that. Like Osareme was saying, it could be even as a result of that, aggressive behavior that may be self-destructive, So many things. Stress can cause a whole lot of things. And don't forget that stress is also a mental illness. It is there. Stress, depression, all those things, mental illnesses joined together, they link one to the other, they link. Okay, we have different symptoms of different symptoms of anxiety disorder, different symptoms. As we can see, we have the behavioral symptoms, we have the physical, we have the psychological symptoms. And like the behavioral symptoms, you would see things like refusal to go outside or leave the home, distress in social situations. You have such situations where someone is actually passing through that, and the person wouldn't want to go out. The person that used to be social will not want to go outside or leave the home, distress in social situations. Maybe when he's outside where there are many people, he may just feel distressed and wants to move and be on his own or leave the gathering of people, and so on and so forth. Substance abuse too, increased use of substance. Behavioral symptoms, increased use of substances. Sorry, something just came up, please. Okay, so distress in social situations, avoidance of some situations, increased substance abuse, use rather. These are some of the things, behavioral symptoms that you would experience or you would see. I'm trying to see how we can meet, but today I will plead with you and crave your indulgence. Network has locked us out for some time. So today I'll just beg for 5 minutes or 10 minutes into 8 o'clock. Pardon me, of course, it's not my fault. It's network challenge. So, but we just have to finish and do what we have to do. So you have things like physical symptoms, muscular pains, aches and pains, neurological issues like sweating, tingling, dizziness, numbness, and a whole lot. These are some physical symptoms. So you just need to maybe take time when you get the slides and then go through them. I'm trying to see, because we have the last but not the least, do a very short module. So anxiety and confidence, it reduces your confidence. When you get anxious, it's just like I told you that story that I told you, when the anxiety was taking a very big part of me, it killed my confidence. I was looking at, I will not be able to do that. I'll not be able to present. And so many thoughts were running in my mind. So it kills your confidence. And how can you regain this confidence? By learning how to cope better and gradually building up to bigger tasks. You do those exercises, you learn the therapeutic way, that is, maybe you do the Kegel, I beg your pardon, not Kegel, but you do the yoga if you don't believe in the spiritual implication, because some people believe in the spiritual implication of yoga. Some people are highly spiritual, they feel it's not right, but yoga is another exercise that can relax your brain and a whole lot, and other exercises as well. So it depends on what you think and you believe in. So confidence can be regained when you keep practicing this gradually. It will help you build up to doing better tasks. One thing about minor anxiety or being anxious is that when it happens to you once or twice, you are able to get rid of it or control it at that point. You get better, you just get better. You only get worse if it is a disorder, but for the normal anxiety, you get better because you leave that one. The next stage where you have to carry out those tasks, you may not have that anxiety issues again if it is just the normal anxiety. So, okay, so we have the the Goldberg anxiety scale is actually something that you can just go through at your own private time. For the past month, these are some of the questions you should ask yourself. You can even carry out that test for yourself. Ask yourself, have you felt keyed up or on edge? Have you been worrying a lot? Have you been irritable? Have you had difficulty relaxing? Now, how can you tell? On the next slide, which is this one, you see that you score 1 point for each. Yes. So you give yourself, you carry out the test for yourself on the other slide. Pardon? Okay, you carry out the test for yourself and then you come up with the answer, score 1 point for each. The average number experienced by African adults is 4. The higher your score, that's answering yes, 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 yes to those questions on the other slide. The higher your score, the more likely that you'll experience disruption in your daily life. So you check how many do you have? What is your score? If you have a score of 8 or more, then you have that means you have a high score. That may mean that you may have tendencies of having an anxiety disorder. So it's a test that you on your own can carry out. But even when you carry the test, do not conclude. Just go ahead and do the right thing. Seek help if the need arises. Now, this anxiety, so many things contribute. Cumulative stress, insecurity, alcohol or drug reactions. It could be biological. It could be as a result of trauma, like I already said. So this anxiety disorders develop from a complex set of risk factors, like we said. Genetics could be that it's in the gene of the family, handed down to you, or it could be as a result of the chemistry in your brain, like I said, imbalances in your brain. It could be as a result of your personality, your life events, things that have happened to you in your life that are traumatic. It could be as a result of most of these things. It could be also as a result of your flight, fight, or freeze. There's something we call that. It could be as a result of your flight, your fight, or your freeze. It's a term that it's always used in a mental health. Anytime we talk about it, fight is simply a response, that prepares you to confront a challenge or a threat. That's fight. Okay, so that's fight. And what does it tell you? When it triggers that, it's telling you that you are fighting back. It's something that you need to fight back or you defend yourself against. That is fight. That's a natural human response. When a human being comes face to face with anything that poses as danger, automatically it sparks that particular fight, that fight tendency, that dangerous situation that you face yourself. Then freeze to sometimes, instead of you fighting back when you see those things or fleeing, you may just feel paralyzed or unable to move. That's like in a situation whereby you go forward, you can't go backward, you cannot go slow. When you come face to face with all these things, there are things that could give you that anxious state, could give you that anxiety disorder. And if not handled, anxiety issues. And if not handled, it could degenerate to becoming a disorder in this case. So we have different things like you've seen there, the trauma, the medical condition, and biological, and so on and so forth. What can you do? What can you do? The solution to this, what you can do, assess frequency of problem anxiety. The time, the period, the level of suffering, response to immediate crisis, panic attacks, suicidal, those are some of the things that you can do to assist anybody that has anxiety. Assistance that you can do. Assess frequency of the problem, because not just once, if it becomes often, then it is no more problem. It's now a disorder. It's no more normal. It becomes a disorder. Respond to immediate crisis when there is any challenge, when When you see any sign of that, respond to it immediately so that it does not degenerate. Show respect to the person always. This is important. This is the relates to what we have been doing in the CACA and in caregiving. Show respect to the person. That the person is anxious or the person is having this, not for you to now go and show the person your talent at that point. No, in such a situation, talent is not needed. You just have to do what you know how to do. Respect the person, because it can happen to anybody. Don't go there saying, why are you behaving like this? Is it not just this? Why are you, and all those kind of things. We know what some people can actually do, to frustrate others. So when you see these things, show respect to the person, investigate further, engage and talk. There's nothing as good as giving someone a listening ear, giving someone a shoulder to lean on, talking to the person, because many people just don't have the right people to talk to when they have issues. And that is very bad. And when people realize that when they share their issues with you, that you have nothing good to do about it, you cannot advise them correctly, or you cannot do anything, at the end of the day, you discourage more people reaching out to you. Encourage the person to seek help or use self-help strategies. Very important for us to do. So there are a couple of things that interfere with the recovery. Behavior, the comfort, the behavior is comfortable and provides a feeling of safety. Sometimes these people may not even see it as if anything is even happening to them. Maybe you as a healthcare practitioner, you are seeing that all is not well. Them themselves may feel that they are in their comfort zone. They may see the behavior as being something that is comfortable to them, that they are safe. It provides them a feeling of safety, just like somebody abusing drugs, and you're trying to let the person know that it's wrong to take drugs and all these things, and the person does not see that what he's doing is wrong. And it's difficult for you to handle a person that doesn't realize that what he or she is doing is wrong. That's the first step. It's not always easy to handle such people. The first step of you succeeding is the person actually knowing that there is a problem, so that the person can work with you to solve the problem. So some of them lack of awareness that anything is wrong, like we said, drug stimulation as a result of drugs, so they don't see anything that is wrong. They are high. That's where they are high. So they've passed the stage of even thinking that they can recover, or in the recovery process, they are not interested. Lack of purpose. There are times people reach the point whereby they lack purpose, meaning no reason to tackle issues. They feel that life has no I have come to my wit's end. Let me use that word. There is nothing I can do. All hell has been let loose. It's a worse scenario. There's nothing I can do. There's no point for me to even try. There's no way out. When they get to those points, that is when they actually do what we know they used to do, suicide and all that. So reassurance seeking too. Reassurance seeking, that is one of the things that is very important. All those things are the things that we can actually. Treatment and interventions. Treatments and interventions. CBT, based on recognizing and challenging thinking distortions. So treatments and interventions, there are a whole lot of treatments that you can help people to manage stress. Medication can help. Management of stress, such people should try to manage their stress levels. We have the CBT too, the cognitive behavioral therapy. The specialists know exactly what to do when it comes to such as situations. Now we also have you referring them to a GP, a counselor. If you see certain things, if you see that a person is suicidal, you see that a person is depressed, that is actually having depression, showing signs of severe neglect, not coping or completely stuck by their fears. They cannot go outside, they cannot go to parties, they cannot interact, they lose control, and they weep, or maybe they're afraid, and all these things. These are some of the signs you should look out for and try to report. Help them. Mental filtering. Now we go to thinking distortions, typical of anxiety. All these are things we have already looked at. Some of them, all or nothing thinking, very black and white, generalizing things, converting positives into negatives, labeling. Sometimes you see people that are anxious. She's always filled with, I don't know, hate. I don't know whether hate or what. The world just revolves around her. That's how she can greet the boss. And just because maybe the boss did not respond due to the fact that the boss did not hear her, that alone puts her in, throughout the day, her mood is just off. She's just, I don't know. So these are some of the things that actually affect our thinking when we are anxious. Okay, I'm trying to see how best we can move. Evidence, okay, challenging distortions. In general, we challenge this by asking questions such as, what is the evidence for that? Is that true? What are the chances of that happening? Some people still do not believe, even when they see it in black and white, that they're actually having challenges, like they're not okay. No, they don't believe. Now, thank God, we just have 3 more slides to go, or 4. We want to talk about suicide. Suicide is very important. A death, not every death, not all death, someone took this or someone took that, is considered or is classified as suicide. Suicide is actually classified, a death is actually classified as suicide when the coroner, based on evidence that a person died as a result of a deliberate act. So any death that has been proven beyond reasonable doubt by the coroner that the person actually died as a result of his or her own deliberate act is considered suicide. Now, in Nigeria and even in the world, it's not the suicide rates that we have. That's why I cannot accurately give you a statistics, because we don't have the right statistics of suicide. Why? Because it's not all deliberate act of death that is reported. Why? Because of stigma. Because if there is a history of one person from a particular family committing suicide, we all know that it's a big stamp and it's a big stain on that family. So because of stigma that we have been talking about from the beginning, most people don't come out to actually. So at the end of the day, we can't have an accurate statistics that these are the number of people that have committed suicide. But from the little statistics we have, what we have been hearing in the news, what we've been hearing on Facebook, you'll agree with me that yes, it is real. Suicide. People have been killing themselves deliberately. Why? Some out of stigmatization. Some people have suicidal ideation. Thoughts that life isn't worth living. Please, at this point, it's unusually quiet, because I know that since we've passed 8 o'clock, some people may say, what is this woman talking and talking? But it is real. Is very, very real. Yes. This particular suicide is the most important of all the modules. We should not take it for granted, because even you as participant there, you'll agree with me that sometimes you feel bad when you hear suicide here and suicide there, because people don't really have the right knowledge. So please, 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 I crave your indulgence to just take time. I will try as much as possible to relieve you as soon as possible. Let us do justice to this particular one. So I'll take your time a little, at least for today. Just forgive me for today alone. So suicidal ideation, some people can feel that life is not worth living. At no point should you think that life is not worth living, or your patient has such thoughts. You should be handy to help to salvage the situation. You understand? It can be a complete preoccupation with self-destruction. There are people that kill themselves because they just want to end it all. Destroy themselves, maybe use something, pierce themselves. There are just some people that derive pleasure in doing harm to themselves. I don't know. Some can be attached to depression. They have been depressed and they don't have any way out. Nobody is helping them. They don't know what to do. They are afraid of stigmatization. The weight is so heavy, like a rock on them, that they cannot even tell someone what they are going through. Imagine what will happen when they keep bottling that or bottling it up. It will keep containing. And when it gets to a limit, the person will want to go and jump in the third into the water, jump off Third Mainland Bridge, because that one is very common. I always hear that. So these are things that we should, when you have anybody that has suicidal ideation, ideation means the idea of suicide. Do not take it for granted. Some of us, somebody can say, oh, I've had enough of life. I just have to end it all. I am tired. There is no money to eat. My children are suffering. I am fed up of this life. I just have to end it all. And in a normal attitude of people, maybe some of us that take things on the surface, will just say, it's not easy. It's like that. We take that statement for granted and we just throw it away. Do not. When someone tells you things like that, don't just take it for granted. Try to get close to the person, ask the person, walk a mile into the person's shoes, even if you cannot help. Just that act of you being concerned and the person expressing his or her feelings and thoughts with you can take away that suicidal ideation in a split second. statistics have it, at least we have statistics that have proved that when people are actually able to share their suicidal attempts, that, oh, I am fed up, I'm just going to kill myself. How I wish I have a knife. How I wish I have poison. How I wish I have a pistol. I'll just end it all. Don't take such for granted. Please do something and act fast. Because if the dead can talk, if the dead people that actually committed the suicide they can play it back like a tape for them to come back to life. You hear that some of the issues they had was nobody was willing to listen to them. Nobody was there to talk to. They couldn't express how they were feeling. So means they are worthless. So what's the best solution is just to go over there and cross over to the other side. And to them, they think that's the end, but that's just the beginning of the whole thing, So suicide is something we frown against, and it happens. Like I told you that sometimes I speak out of experience, though I've not tried to commit suicide, but we've had sometimes of depression, so I can tell you how it feels when someone has depression. So the thing the people need at that point is just someone that understands. That's all. Now, group of people that are at risk of suicide, people that experience mental illnesses, people that have mental illnesses are prone to suicide because of stigmatization. Like I said, lesbians, gay people, bisexual, how those people with different sexualities, how they are treated in some societies, especially us, So once they know you have this, automatically it comes with depression for some, because the way you'll be treated like less of a human being. Let me just say so. So no need to go into detail. So there are people that are susceptible to committing suicide. They're at risk of that. People that are bereaved by suicide, again, people that have had siblings or friends or people that have actually committed suicide. Remember when I told you that as a healthcare practitioner, that if you have the right knowledge and you have the right knowledge that you can, and you talk to someone that has suicidal ideation, you have helped a whole lot. It's just like train a female child, you train the whole generation. Yes, because female will keep giving birth and then they keep extending. So and more people get educated. So that's just it. So when you save one person from committing suicide, you have saved a whole lot of people from perhaps committing suicide because of the pressure, because of the stigma, because of what they will feel. And you wouldn't understand what you have done if you can help one person with such a challenge. You can also ensure that emergency services, you reach out to them, you call for help for them when they need help, you refer them to GPs. So people that can have these issues, you can see them there. People that are exposed to violence, I've had one child before said, I want to kill myself. A child in a school, I'm telling you the truth. When I say things, I say it out of, I've seen it all. I've seen it all. Left, right, front, back, I've had it all. I've seen different faces. So the child came and told me teacher, I felt like just killing myself and all that. And I felt scared. How can a child of that age, of 7 years, tell me why? Because that child has been exposed to violence. She's grown up in a home whereby the father the father is a boxer and the mother perhaps a boxer. So two of them, they are boxers. So the children, that's boxer in quotes, that's not professional boxers, but their own. They are boxers that are not paid. They pay themselves. So when they have the problem in the house, they begin to box themselves. This child is exposed to violence. In fact, her greeting is, if she doesn't do anything in a violent form, she has not started. So over time, that girl faced all these things and she's exposed to violence. So she doesn't even, that's why she told me, teacher, I just feel like killing myself because my father and my mother always fight. And when I go to my father, tell my father to stop beating my mother, my father descends on me. A child at that age. So a whole lot of things affect people. Before you see somebody commit suicide, sorry, if I want to talk about it, we'll stay here till tomorrow morning. But these are the group and the people that are prone to having, and especially now with the economy, like I said, people can end it all. So that things are getting worse. So what am I cannot take care of my family, I cannot feed my children, I cannot pay their watch people closely. Sorry, I don't know. So suicide rates are higher among men compared to women. Yes, because that just a little thing. Somebody that loves a know what would happen. You are even hear things parts of those people is easier, because when you are able to get the things they really love best, you get to if that suicide is wrong. These are some of the things that will make people. There are people that no matter what, even if you don't have what to eat, they don't go for suicide, because automatically and has a purpose in life will not think of suicide. So these are the protective factors that are necessary. Social and economic factors that and so on and so forth. A whole lot. Availability of particularly lethal methods of suicide, like of killing yourself. Don't mince words. Are you having thoughts of suicide? Have you been thinking about suicide? You are trying to assess the person. You are trying to assess the risk of that person actually goes a long way in helping the person. Even, do you have specific suicide plan? Okay. How do you that is the truth. But with the right strategies, you can still help to you can still achieve these things. Not too many words. I will done. This was all emergency numbers. Take the person to see a GP. If you can stay with the can't stay persons and help